Okay, no worries, I'm recording. All right, so I'm going to go ahead and talk about living on purpose and how to create or develop a care plan. And as the speakers come up, I will introduce their topics as well as what their bio, what they're talking about. So at this point, I just wanted to, when we started talking about this, it really came short notice and God just placed in my heart to do this. And I called out on my fellow colleagues and friends and sisters, and they graciously said yes. But what I thought about was we so in the current time involved with how busy we are in a different sense than what we're used to, more so focusing on what we're doing on our jobs, taking care of those sick individuals coming in. And I thought, wow, what about having a framework? What is it that can really help our nurses, our frontliners, our policemen and women, everyone out there really working hard to make the society safe? And I felt the 5P success formula would be a great thing to really bring to the forefront and remind each and every one of us that we must have a structure in place. We can see from this pandemic that when we don't have a structure, things fall apart. It is very evident that certain things were not put in place for our healthcare system, and as a result, we have suffered the consequences. So, give me 1 second. I think I am not in gallery view.
Not you, Doc. Go ahead.
Okay. Can you still see me?
Yes.
All right. So with the 5Ps, that is my structure that I have lived with. They're my philosophies that I have used for my entire life. And I think that if it has helped me, it can definitely help others, because there is one thing we must remember. If you do not stand for something, you will fall for anything. And if you do not have a plan in place, one of my late colleagues used to say, piss poor planning gives you piss poor results. So if you have no structure or plan in place, then you're not going anywhere. You're just living life, hoping things will fall in place. We as nurses talk about the nursing care plan on a daily basis. I know I, for one, hated it when I was in college, but it teaches us something that you have to learn about it, assess it, come up with a plan, and then implement it. So it's life. It's the same way with life. So right now, with what we're going through, you simply need to know what you are doing. And that is what it means to live on purpose. What are you doing? What goals do you have? And what are you passionate about? Are you just existing? So let's think about these 5Ps. Living on those 5Ps, what are those 5Ps? Your purpose, which is what I just talked about. Your passion, what do you like to do? Patience, how much patience do you have? Perseverance and persistence. When you think of your purpose, ask yourself this question. Now that I know my purpose, what is next? What am I going to do and how am I going to do it? You want to go from point A to point B, but what are those things that you need to put in place while you're walking on that journey to point B? And you got to be ready. You have to have that plan that you're going to follow, because as we know, life has a way of doing business, right? Those stumbling blocks that you're going to come across, those challenges that you're going to face. But if you have a plan, you can always fall back and revise that plan, reevaluate it, and see what is going wrong, what you're not doing well, to change it. That is why that is so important, that we live on purpose. You need guiding principles, and these are the 5 Ps. What has happened to you in the past is important in the sense that if you're using those lessons that you learned from what happened in the past now to change your situation, to perfect your situation, or to live better and impact more people, then it's influential. But if you're living in the past to just say, oh, I suffered through nursing school, oh, my boss did this to me, you're worrying about things you have no control over. Worry about what you can control. What you can control is you, because you're the captain of your own ship. When you can control you, you can then give more of that love to others and your patients, and they will receive it better and it will be more impactful. While you're doing this, when life knocks you down, how do you get back up? You have to be patient. We live in a culture and society that we're expecting things to happen on the fly. You're expecting things to happen now the way you want it. But may I remind all of us that we got to exercise patience if we want to get to our destination. Because it is just how life is. You will get knocked down several times. But if you exercise patience, what God has already instilled in you will come out at its predestined time. You don't have to rush it, but you do have to do your own work. You do have to take action and put in place what you need, again, to get from point A to point B. And it's just as simple as taking care of yourself that we're going to be impounding on today. All right? So, passion is what you love to do. Passion is what you decided you wanted to become a nurse. I hope you're not those nurses that are coming in just for the paycheck. Because if you're one of those, I can guarantee right now that you're more stressed than a nurse who is doing this because they're passionate about helping people. Remember that you're in the business of healing. And that business of healing, you have to be whole and total to be able to impact those lives and help in the healing process. When you're weak and worried, when you're stressed out, that stress and weakness can transcend to your patients. And your patients are not resting well because they see your stress, they feel your stress. So that is why it's more important that we take care of us. Not just for us, but also how we will pass that energy onto the ones that we care for. We need to fill our cups. If your cup of love, it's not full, then you cannot give to others. So by taking care of yourself, you're building your health, you're building your wealth. Now, when you're healthy and happy and you have love and peace to give, now you can give that to your patients. You can share that with your people that are coming into your life that you're helping. So self-care is not a one-size-fits-all. As you're exercising all of these things that I'm talking about, you do have to identify the strategies that work best for you. And to work on those strategies, don't think that what has worked for somebody else is going to necessarily work for you. That is why self-care is so important. So identify what is working for you and work on that. And don't give up when you meet those stumbling blocks. Don't stop, because if you do, you have failed not only yourself, but you're failing those who are relying on you for inspiration. You are failing those who are relying on you for empowerment, for encouragement, and to help them. That those who are not able to help themselves, but your story alone can help someone. Your story alone can impact so many other lives. One of my favorite mentors, Les Brown, always says, you can find the richest people in the graveyard. Do you want to be that person, that individual who has a story and you're going to die with it without sharing? Are you going to be that nurse Who has a story that can be put into a book and leave a legacy or help others? Are you going to die with it? Think about it. You're a nurse for a reason. It is a calling. It is not just going to work and coming home. That is why this year, 2020, the World Health Organization declared it as the year of the nurse and midwife. And on January 1st of this year, the American Nurses Association also said, let's make May the month of the nurse. My question to us as a culture in nursing is this: why are we not celebrating nurses every day of the year, 365 days? If we're not officially doing that, guess what? We as individuals, professionals, and leaders in our communities should celebrate nurses every day. If you're in leadership, you should be celebrating your staff on a daily basis, not just when there's crisis. Make them feel wanted. Make them feel like you believe in them. Make them feel like they have value, they're bringing value on the table. And trust me, we will have a much healthier workforce if we started thinking and treating each other, not just with respect and dignity, but paying close attention to their emotional well-being, paying close attention to their needs. Because when we can cater to their needs, now we cater to what they're able to do. And your organization will be much more productive, and everybody will work in unison and be happy. So let me just steal this time to talk about how to develop that self-care plan, because the leaders are going to talk to you today about some tips and strategies that you can implement to take care of you. If you remember when you get on an airplane, when they're doing, you know, the air hostesses are doing the safety instructions, what do they say first? You have to put your oxygen mask on first and then help the others. So we are carrying a whole load on us nurses. You are going through a crisis with this COVID-19 pandemic. What is happening is, like we always forget ourselves, we're doing so more. You are wearing so many hats right now. You have worn many hats in the past, but now it's even more, because you're not only a mother, a wife, a daughter, a cousin, what have you. You are now a family member. You are now a power of attorney. The only difference is your name is not on that document. These family members are not at the bedside with the COVID-19 situation. You are having to provide care. But because of what you're seeing over and over, the dead bodies, the struggle, the lack of support, because we cannot keep family members just for fear of infecting them. And we understand that. So you're carrying a heavy load. Your heart is heavy. So, my dear brothers and sisters and fellow colleagues, it is okay to stop and think of you. It is okay to say, I cannot do this just right now. It is okay to say, my supervisor, I am so tired. I just cannot pull this right now. It is okay to say to your team member, help me out with this and that. I just need to breathe. I need a break. It's okay to step away from it. That is why you have a team, and everybody pulling together with the variety of skills, you all can pull it together. We have done it for this long. If Florence Nightingale, the founder of nursing, was here today, as we celebrate her bicentennial, what would have been her bicentennial birthday, she would say, I said so. Hand washing. She would say, now we can wash our hands. So my dear brothers and sisters, let us develop and create a self-care plan for ourselves. Let me talk about that for a brief moment. What is really a self-care plan? It is just like your nursing care plan. You have to have a plan in place, as I mentioned earlier, because if you do not have a plan in place, when you have trouble, then you have nothing to fall back to. So basically, you need a maintenance self-care plan, things that you do on a daily basis, and you need an emergency self-care plan, things that you can fall back to in the midst of crisis when what you're doing daily is not working. And how do you do that? You basically do that by identifying what your values and what you need on a daily basis to live a better life, to live a fulfilling life, to live a healthy life, whether it's exercising, whether it's doing certain routines, or whether it's whatever you want to do to make you feel whole, because it's about putting your mind, body, and soul, your finances, your relationships together. Because by being so busy, we forget about these components that make us whole. Identify those strategies that is going to help you live through it. The only common thing that we have when you do these self-care plans, whether it's maintenance or the emergency, is that we all have to be committed. Even though all our plans are different, we must be committed. If you're not committed, you will very easily give up when you meet the stumbling blocks. So the steps to do it, how do you actually do that plan? Figure out for yourself, and there are tools out there that you can use. What is it that you're doing right now to cope with stress? Identify what is working. Do that assessment. Maybe, is it your life that is causing you stress, that is making you unhappy? And what is it about that life? Maybe you're taking on too much. Maybe you're trying to carry everybody on your back and you possibly cannot do that. Maybe just you're hanging with the wrong crowd. Identify those negatives. Maybe your goal should be to do away with the negative behaviors or negative strategies that are affecting you and pull together some positive. Maybe start thinking about putting together more of a positive mindset. One of the leaders will be talking about mindfulness today and gratitude. So those are some of the things you can do. The second step is, what do you do for self-care now? Are those things working? Do you need to write them down? Do you need to have an accountability partner? Because you're not just writing these down, you're going to have your friends and family, colleagues and mentors hold you accountable. Because I believe that when someone holds you accountable and you're aware that somebody is watching you and rooting for your success, you're bound to hold on and hang in there when life gets rough. Now, you can also, those maintenance, on the maintenance self-care schedule, think of the things that you can pull out of what you're using right now that is not working and add on to some new things, and try to figure out the obstacles that you're facing. What are those obstacles? And do away with them. And there are a lot of maintenance self-care worksheets out there on Google. You can Google that and actually download it, work on the worksheet, and identify what your potential barriers are. Why are you not meeting your goal of exercising 3 times a week as you wanted to? Why are you not meeting the goal of maybe getting a pedicure and a manicure once a week? Or why are you not able to just maybe go to your quiet place and rest your feet and say your prayers? It is what you choose to do. It is very minimal things that you can do to make yourself happy. Make notes. Put some notes attached to your activities, okay? And what have you been doing for your emergency plan? What do you do under a crisis? Develop a framework, whether it's your 5 Ps. One of my friends talks about the 5 Gs, Jessica Moyer. Follow what you want, what is going to work for you with your schedule and the environment that you live in. But the key is really having a framework in place and make a commitment. So, ladies and gentlemen, my brothers and sisters and fellow colleagues, put your mask on first. Put your mask on first. When you put your mask on first, then you can do for others what will be impactful and what will be appreciated There's a saying out there that people will always remember how you treated them, but not what you did for them. So as you go out and serve selflessly, with determination, under these circumstances, you have always been our heroes. You are not just heroes today because of the crisis, but we salute you and we tell you you deserve it and even more. So go out there, follow your plan, implement it, and reevaluate when it's not working. So I hope that has been helpful, and I can share more about how you develop your care plan. If those of you who have questions, I would be glad to answer those at the end of the presentations. So I see that I probably went past my time. So I am going to stop right here, and I'm going to introduce the next speaker, who will be Mama Stella, also known as Stella Chebe. And I have her bio here. I'm going to read directly from her book that she just published. And if you don't have a copy of this, ladies, you should get a copy. Stop sitting on your greatness. It's an amazing life journey. And I had the privilege of reading this manuscript. I can guarantee you that you will enjoy reading this book, and every single nurse should really get a copy of this book, because she is a nurse and she went through struggles to get to where she is, because we often forget about success. Success doesn't come overnight. Success comes when you have failed and failed and failed 1,000 times, and then your breakthrough comes. So do not give up. So at this time, I will introduce Mama Stella. Stella Chebe is the president and founder of Kankwen Foundation, and her focus is on changing lives and making a contribution to help orphans and needy kids in Cameroon, West Africa. Stella received a Bachelor of Science degree in nursing from Grambling State University, and she is a registered nurse by trade. Stella is also a professional network marketer. She has been profiled in Your Business at Home magazine 2010, 2011, and 2012 as a top earner and leader in the direct sales industry. She is a mother of many orphans. She is a wife. She's a workshop leader. She's a performance coach and an enticing speaker with audiences in Cameroon and America. She was the keynote speaker at Delaware State University Nursing graduation ceremony pinning program in 2014. Through her coaching and training workshops, Stella has developed many top producing leaders and has impacted the lives of people around the world. She has mentored and inspired thousands of business-minded professionals from diverse backgrounds. Stella's mission is helping people become aware of what they are capable of doing. She will contribute in changing the world using her story and her book and her message. Please help me welcome Stella Chebe, AKA Mama Stella.
Hello, everyone. Thank you so much, Dr. Eunice, for that introduction. And I just want to give it back to you for actually taking the initiative on creating a forum where we could actually acknowledge the frontline workers and especially celebrate nurses, because this is our week. And I am really, really excited to be a part of this Zoom meeting. So with that said, ladies and gentlemen, I want to share with you, stop sitting on your self-care as healthcare workers during this pandemic. As you heard from Dr. Eunice, I just launched my first book, Stop Sitting on Your Greatness. And under that umbrella of Stop Sitting on Your Greatness, I do believe that as nurses, we have to stop sitting on our self-care, because as nurses, we focus on taking care of other people more than we really focus on taking care of us. And during this tough time, ladies and gentlemen, I do believe that if we don't create the time to take care of ourselves, guess what? we will not be able to take care of our loved ones and the people we take care of in the hospital. So I want to start by really acknowledging all the nurses all over the world and those of you on this platform who have sacrificed your time, you've sacrificed your life to really serve during this pandemic. When you are a nurse, you know that every day you will actually touch somebody's life or somebody will touch your life. And in these trying moments, you know, with COVID-19 and the pandemic, I start to wonder, and some of the nurses that I've spoken to, there are days they don't want to go to work because they are thinking, will I really make a difference in somebody's life, or will I actually pick up COVID from somebody? And it is a moment that we have to sit and reflect and think of. I want you to know that being a nurse is just another name that describes a person that is strong enough to tolerate anything and soft enough to understand anyone. Because when we puzzle in between, should I go or should I not? At the same time, you are strong enough to tolerate that 12-hour shift. You are strong enough to tolerate those COVID patients, but it all starts by you taking care of yourself. I do believe that every nurse was drawn to nursing because you have a desire to care, you have a desire to serve, and you have a desire to help somebody. And as I said, if we cannot help ourselves first, how can you help others? Self-care starts with you as a nurse. Eating well, eating to boost your immune system, eating the necessary vegetables, the vitamins, the nutrients that will give you that energy, that will protect yourself from acquiring or picking up other things when you go out there in the workforce. Being a nurse, you have to create a time for yourself, ladies and gentlemen. And one of the things that I use every day is meditation. It is hard to be still and know that He's God. But as nurses, if you can actually create a time every day for yourself to just spend that 10 minutes with yourself and be still and create your day before you go to work, it will make a difference. The second thing that I do on a daily basis is I do journaling. At times I just sit and I write. You know, I think of the work I did yesterday and the patients I saw and what happened. And the only way to take it out from here is actually putting it into writing. Because once it's here, ladies and gentlemen, you get so congested with all the junk. Oh, this patient died on me, this happened. You got to release. And the way you release is taking it out from here, the mental state, into paper and just write. I can remember there was a day at work where everything was going like crazy. You have to take breaks for yourself. I had to take a break and I went into the bathroom and I sat there and I had to meditate. And I want to encourage you that you can do that if you are practicing as a nurse. Take those little breaks and go sit somewhere quiet to take care of yourself, to release the things that are stuck in there that are giving you worry. The next thing I want to share with you is that you have to manage your time. And don't be afraid to say no. Manage your time and don't be afraid to say no. And I'm going to speak particularly to the immigrant nurses, African nurses, Filipinos, because we are always looking for extra hours, picking up all these extra hours, right? When do you have time to really rest? When do you have time to really take care of yourself? If you keep doing what you're doing, picking up all these extra hours, how long will you do that? I want to share with you one thing. Our bodies, I will compare our bodies to a car. You know your car, when you're using your car and you're putting mileage on it, you're putting mileage. What happens? Eventually, it will stop working. So just look at your body like a car. And when you're pulling up all these extra hours, you're just putting mileage on yourself and you're not taking time for yourself to rejuvenate, to rebuild, and to gain that power to be able to keep doing what you had promised you would do, which is really serving and helping others. So during the pandemic, there is a shortage. People don't want to go to work. Will you be the one to say, oh, I want to pick the extra hours? No, there should be times that you can say, no, I want to take this day off for myself. I want to take this time to give myself a treat. I want to take this time to just sleep and rest. Sleep is part of the process, ladies and gentlemen. As a nurse, you got to have enough rest for yourself. If you're not sleeping enough, that is how, when you go to work the next day, you're overwhelmed and you can easily make a mistake. And those mistakes could go to impact somebody else's life. So really think about it. Self-care. Will you be sitting on your self-care during this pandemic? As Dr. Eunice has said, you have to put on your own mask first. If you're not putting on your own mask first, you're exposing yourself to the virus. And one thing I've discovered about the virus is not a respecter of individuals. It can attack anybody. So are you protecting yourself? Are you wearing your PPDs? You know, because when this whole pandemic started, some of the nurses were in denial. They were like, oh no, this, that. It is reality, ladies and gentlemen, that we have to put on our PPDs and protect ourselves first so that we can protect our families. Can you imagine you being negligent with your self-care and then you pick up this COVID-19 virus and then you bring it into your own household? So just reflect about that. The next point I want to talk on is leave work at work. Don't carry it home. Leave work at work. Don't carry it home. You know, at times we are tempted to carry our work back home. No, it doesn't serve you. Before you leave, what I do, I always share from a position of strength. Before I leave my job, after I've given report and I've done everything, I go to a quiet place, I sit down and I reflect, and at times that is when I journal. I just take it off my brain into a piece of paper, fold the piece of paper up, put it in trash, like letting it go before I walk out of the hospital. So if you can actually practice that, I think it will help you to stay stronger, to be in the right mindset, to be able to help the next person who needs our care or who needs our help. You got to spend time, ladies and gentlemen, to motivate yourself, to empower yourself. At times, what I do is you can actually listen to motivational speakers like Les Brown, as Dr. Eunice has already mentioned. I go to YouTube when I'm driving home and I Google something and I'm listening on my way home. That is taking care of myself. Because if I'm not empowered, how can I empower my patient? If I'm not healthy, how can I empower my patient? And I was reading a story that said, you know, when you are a healthy nurse, your patient will listen to you better rather than somebody who is not healthy. Because they are judging you, they are looking at you like, what is she talking about, eating healthy and she's this or that? So we should lead by example. So lead by example. Lead your patients by doing the right things. Instead of eating chips, eat an apple for a snack. Just those little things can make a difference. Instead of drinking a soda, drink some water. Hydrate yourself in the right way. And in my book, I shared when life calls us to be greater, we have a say in how we answer. You have a say to how you're going to answer this call of being a nurse. Are you in nursing to make a difference, or are you in nursing just to make the money? And the reason I ask that question, none of the answer, right, yes or no, doesn't mean anything. But I just want you to reflect, why am I a nurse? Just think for a moment, why am I in this profession? And if you can answer that question, then self-care is eminent. It is not something that somebody even has to remind you of, because you know that you have to take care of yourself so that you can be there, not just for your patients, for your family, and for the people around you. So I urge you to stop sitting on your self-care as a healthcare provider during these difficult moments. And I want to acknowledge you as nurses who are sacrificing, or who you have sacrificed your time during these periods, during these difficult moments. And remember, when you get home, take off all those things, your shoes, your clothes in the garage before you get into your house. And you go straight to the shower, because you don't want to carry COVID-19 from the hospital into your house. So with that said, ladies and gentlemen, it's been my pleasure sharing some tools that you could use to take care of yourself during this moment, so that you can be the space for other people and you can be the one to take care of your patients. So with that said, thank you so much, Dr. Gwamesia, for the opportunity, and I want to turn it over to you. Doc, are you there? Hello?
Perhaps she's not.
Okay, if she's not, I'm going to be giving my tribute while she comes.
Okay.
All right. So I know she had mentioned that we can actually give tributes to people who've made impacts in our career. When I came to know Dr. Gwamesia, she actually has made a huge contribution in my career as a nurse. So I want to take this time to acknowledge you, Dr. Gwamesia, for your strength, for your confidence, and your contribution that you are, not just to me, but to the world. And to all the nursing students that you have impacted, I want to say thank you. You have impacted my career as a nurse by showing me that I should not limit myself because I'm an African. Cultural diversity. No, I could still show up powerfully, even with an accent, and don't have anybody tell me what I should do or what I should not do because I'm from Africa. So thank you for giving me that courage that I could look my boss in his eye and say, hell no, I'm not working tomorrow, and not be scared that I'll be fired because I'm an African. So thank you, Dr. Gwamesia, for that courage and for the confidence and for who you are. She's still not back? Over to you, Doc. So let's give it up to Dr. Gwamesia. We do this in Zoom. Yay! All right, let me mute myself. Did she go somewhere?
Oh, God.
Well, I
Hello,
think I
Doc.
was next, so I can continue.
All right.
Now you can continue, Doc.
Should I go ahead?
Yes.
Okay. Hi, everyone. My name is Gifty Boateng. I know American way is Gifty Boateng. Sorry. I'm a clinical coordinator in a post-anesthesia care unit at Bay Health Medical Center. I have been a nurse over 16 years, and I am a servant of God. I love doing his work, and that's what drove me to the nursing. I have been called to care for others. I'm also a co-founder for a brand new organization. It's called Noble Nurses Network. And knowing that our profession is noble, nursing is very noble. Just to have a group of nurses come together, just passionate for nurses, educating us, empowering each other, encouraging each other, and trying to engage us and also helping our community. So very passionate. This is a big opportunity for me to join you guys this afternoon to celebrate us nurses. I think most of you probably know who I am. I'm very passionate about nursing, very, very passionate. And when I heard toward the end of last year that the World Health Organization had deemed 2020 as the year of the nurse and midwife, I took off. I had my pilot on, my pilot hat on, that I was taking off with it. Because yes, it was time for us to celebrate us for the hard work that we do, for the sacrifices that we placed on our lives and putting others, first. It was time for us to celebrate us. So I'm very passionate. And with COVID or without COVID, it is still the year of the nurse and midwife. So we're gonna continue to celebrate our profession. Nursing have been rated with the Gallup poll, been the 18th year as the trusted profession. So that make you understand that nursing, we are very special, very, very special. So I thank God for this opportunity again. So my topic, when Dr. Yu called me and said, what would I be talking about? Like, oh gosh. But one thing about me is I love encouraging and empowering nurses, my coworkers. Being in the leadership position, always whoever is working with me or not working with me, nursing in general, whatever I could do to empower them. So the topic that I'll be sharing today is empowering nurses to be resilient and prevent burnout. Let's just picture something for a minute with everything that's going on in the world today with COVID. Let's say you're a nurse, you went on your unit, you work on a COVID unit. We know how COVID is attacking patients. They go down fast. You had 4 patients die on your unit that particular shift. And you are working that the next day. And the 4 patients that passed away, 2 of them were your patients. Imagine you have to be the nurse in the front line. You have to call the family to let them know that that patient had passed away, and you are scheduled to come back the next day. And so for then the next week, you are scheduled to work and seeing patients dying every day. It's continuous thing. Every day you go to work, somebody passed away. How do you get empowered? How do you get empowered to keep doing what you love to do, or that what you have called to do? So that's what I'm gonna kind of touch about. So resilient is to be able to withstand and recover quickly after an event or a condition. So how do you bounce back after going through all this trauma at work? How do you bounce back? Being a resilient is a great characteristic of nurses. You know, one thing we hear, nurses are, they have empathy, nurses are compassionate. Nurses also, we have resilient. If you have a resilient, then you'll be able to bounce back and still give the best care that you are called to do for your patients. So being a resilient nurse is a great characteristic. When we do interviews or you go to interviews, the person might ask you, how do you deal with difficult situations? They are testing you for your resiliency. How do you deal with difficult situations? Because that's what nursing is. There's going to be a lot of code grays, there's going to be a lot of code blues, and everything else within the unit. How do you bounce back in situations like that? Or even when you're having situations at home and you have to go to work, how do you bounce back or balance that work-life relationship or work-life situations? So that's what the resiliency is. So the challenges and the struggles that we are facing right now, it makes it very difficult for nurses to develop this resilient characteristics. That is why it is very important for us to empower nurses, empower each other. If you are in a leadership position, this is why we have to empower each other in order to for the nurses to be resilient and to prevent burnout. What are some of the characteristics that might lead to burnout or making nurses less resilient? Compassion fatigue, burnout, physical, emotional stressors that we deal with at work, and then secondary trauma. I know, you know, secondary trauma phenomena. Things take tolls on us nurses in the front line. Once we deal with death, we go home, now we're thinking about it. The anxiety, the sleepless night, the depression, everything sinks in. So if a nurse is not resilient enough to bounce back from everything that they've been through at the bedside or on the front line, then they're not going to be able to perform. They're not going to provide excellent patient care. Patient safety is at jeopardy, and the patient experience is not good. So empowering us nurses to be more resilient is a key role, especially during COVID right now. I have coworkers that have been pulled from different areas of the hospital to go work in the COVID floor. Now, if you work in a certain areas or departments like operating room or cath lab, and you have never worked on a med-surg floor or ICU or IMC floor, and you get pulled to these floors, how do you empower these staff to provide the care? How do you empower them? So this topic is very, very, so from a leadership perspective, what are some of the strategies that we could do? Or being a coworker, what are some of the strategies we could do for our coworkers to empower them to be more resilient? There needs to be more education. Just like what Dr. Eunice is doing right now. There need to be more education. People need to be aware. People needs to be aware. You know, at my organization, we have something called Co-Lavender. When there is a crisis or event that happens on the unit and the unit need a little debriefing or stress relief, they will call this team, they will come, kind of taking care of the caregiver. That's what we call it. We take care of the caregiver. Also, we just implemented something called CISM. It's a crisis intervention stress management group. Also there to support the team, being available for the team, and some other things that the floor might need. There could be a lean on me team, somebody that you could lean on when issues are going on your unit. So there's a lot of stuff that we could do as individual, as leaders, as co-workers to try to kind of empower each other. The other things also that we could do is making sure our staff knows that we value them, that we value them. Because if you don't feel valued, then you're not gonna perform the great patient care you need to be performing. So we need to recognize our coworkers, recognize our staff members that they are valued, they are important for your unit, for the organization. Also, we need to make sure we really pay attention to their emotional stress. One thing as a person, myself personally, that I do now, because some of my staff members have been deployed to other unit, is I make sure I'm speaking to them every day. Physically, I'm going to the unit. Hey, are you okay? Do you need anything? Is there anything I can get for you? You need to have that relationship for them to know that they're valued. You know, even though they're not in your unit, wherever they are, you value them. Building stronger relationship is the key. Building stronger relationship with each other, your coworkers, your team members is the key. One thing when I was putting things together, I have talked about this not long ago at an organization, how to empower other nurses. And things that keep sticking in my head is, one, Dr. Guarmisia says 5 Ps. Yesterday, yes, I learned that 5 Gs. Now there's the 6 Es. The 6 Es. Empowering your staff members, encouraging your staff members, educating them, making sure the resources, the education that they need, they have. There's a lot of tools that are out there for staff members. There are a lot of apps that are out there for staff members. So whatever resource that they need, educate them, and then enhance them. Tell them to embrace whatever is going on. Yes, it's not a pretty picture that we get deployed to other unit. Yes, it's not a pretty picture that we have to be the COVID unit. Yes, it's not a pretty picture that we are nurses, but you are called to do this. You are called to do this. And then the last one, to engage. Get them to engage in whatever they are doing. Now, it increased staff satisfaction. It increased patient satisfaction. It decreased safety. Safety is a big issue. If staff are not resilient and they have all these burnout on their head and they're taking care of patient, guess how many medical errors are gonna happen? And no organization wants that, because that's gonna be going to suing. So we need to make our staff more resilient. And by doing that, educate them, help them, make them feel as part of your team. Don't leave them left out. Don't leave them left out. And also help them. Let them see that you are there, you feel them, be that empathetic, put yourself in their shoes. So one thing about me that I do, I'm on the unit. I'm taking care of patients when they are short. My hand is in it. We all getting our hands dirty. So whatever we have to do to care for the patient, you're going to see me doing the same thing. It makes the staff feel like, yes, my leader is also part of our team. They are helping. So that's another thing that we could do. And lastly, I find a quote about resiliency that I wanted to share. It says, when we learn how to become resilient, we learn to embrace the beauty broad spectrum of the human experience. And it's by Jada Dweck. When we learn to become resilient, we learn to embrace the beauty broad spectrum of human experience. So when we are more resilient, we don't look at just, you look at the broad picture, how the beauty of the broad picture. It helps us mentally, emotionally, spiritually. It helps us all of it. So that's how we can do to prevent burnout, is to empower our coworkers, empower our staff. Thank you.
Thank you.
Wow, that is awesome. That is awesome. Gifty, definitely the 6 E's now is in my book. You know, empower, encourage, educate, enhance, embrace, and engage. That is phenomenal. Thank you so much for that great presentation and emphasizing on the need for leaders to become aware of what's happening with their staff. That emotional piece is very vital right now, because we know that the stress that we're experiencing is more than what we've ever experienced before. So just being aware of that emotional, the possibility of the emotional instability is very helpful, so that we can prevent the burnout and help our nurses stay resilient, so they can provide that culturally competent and safe care to those that are coming to us in need. Again, thank you so much. What did I just do with my schedule? So, are we all doing okay?
Yes.
Awesome, awesome. And Mama Stella, I'm so sorry. I lost my my power to my computer, so I did not get to hear the last portion of your presentation, but I know you probably did a phenomenal job because you started off very strong. So I hope everyone is staying put and grab a glass of tea or coffee. You know, it's a long afternoon. So I'm not sure if Angelia, did Angelia make it in?
Not yet, but I know that she's on her way.
Okay.
So I don't know if you want Gifty to do her tribute.
Yes, Gifty. I don't think Gifty was. You're on mute, Gifty.
My tribute is to God.
Awesome.
And also to my parents, I guess, is the name that they named me with. The Gifty. And it means a gift from God. So I give to my parents, and I give what God has instilled in me to others. So that's my tribute.
Awesome, awesome. Yeah, I always thought that name had some special meaning, because you truly do give, and always with a smile. And you know, I honestly have so much joy in my heart, especially when I see my own former students, now colleagues, and doing great things in the community. It really makes the life of an educator. I could not be more proud of you, Gifty, and I honestly want to salute you.
Thank you.
Especially
Thank
on
you.
this Nurses Day. I celebrate you daily, and just keep up the good work, because you definitely do touch lives. And I have
Thank you.
seen you at the bedside, your potential from helping your staff. I remember when my dad had his pacemaker put in day surgery, and you're just walking around there like you're walking on the floor. No one could tell you're the supervisor. You know, some people wear that white jacket and it takes up something over their head, but you're just so humble and you stay with your staff and you do check on them. I can attest to that. So I just want to thank you for that and for the nurse that you are. And I'm proud that I had a little to do with that.
You do.
So we're going to change
appreciate you,
gears
sis.
here a little bit. Since Angie is running behind, we're going to ask Dr. Lois to go ahead and do her presentation. If she is on, let me actually, give me 1 second. I'm going to move this around. Dr. Lois, are you on?
I'm on. It's just that I don't know what is wrong with my video. I don't.
Your video is not coming on?
Yeah.
Uh-oh.
So I don't know if it's on my side or your side.
Did she? I think she needs to restart her video, maybe.
Just go to your taskbar and see if you can restart your
Yeah, because I can see that her video has stopped.
Okay.
So just go.
I'm there.
Yes.
And can you see her slide on my screen? Or
No. No.
All right. I'm not sharing. Let's see. Hold on, guys. You know, I'm learning this technology. Hold on.
Technology is not easy, being an immigrant and an immigrant to technology.
Thank you, Connie, for that reminder. That can only come from an IT nurse. Hold on, give me 1 second. Where's my let me see here. Okay, share my screen. Hold on, I'm getting to it, guys. Now, can you see it now?
Yeah.
Okay.
I can see
Let
that.
me introduce her. And then she will do her presentation. Dr. Lois is an actress. She is she has a PhD in educational counseling. She's also a producer, a business owner, and a philanthropist. The CEO and owner of Unity Home Care LLC, Hope Grace Healthcare LLC, and she is also the founder of Lois Entertainment Award USA. She currently serves as a chaplain as well and has multiple awards. She's a multiple awards winner and a social entrepreneur. Please help me welcome Dr. Ekwe Lois.
Welcome.
My video went off. Let me see.
It went off again?
I don't know, but okay, it's okay. I think it's because you put this.
But we can see you.
Okay,
we can see you.
Oh, then it's okay. Yeah, I'm really, really so happy to be among you people. I was touched by the last speaker when she talked about being, being a woman of God. I was really touched because I understand what that means, in a society and in a community. I'm also a woman of God. I'm a reverend, though. So I was really touched and I really love God so much. So I really want to thank those that are in this forum also. Thanks for meeting you guys and knowing you guys. And I really want to thank Dr. Eunice so much for what she is doing and what she is putting in the community. And thanks connecting with you through our face mask. Thank you so much, Dr. Eunice. So I want to talk about how to take care of your symptoms, which is like to avoid some of the strategies to avoid depression. And I just want to talk a little about myself. I'm a chaplain, so before you talk about depression, you have to first of all talk like what made you to become a chaplain. If we talk about to avoid depression, actually, you can't avoid it. As a chaplain, you can never avoid it. You just have to deal with it and work on it. Deal with it and work on it. And some of the skills or the management to avoid it is you have to exercise yourself. Always try to exercise your body, exercise yourself, exercise your mind, because when you are depressed, you have a lot of things that are in your mind, you know. You can go up, you can go down, and at that time, you don't even think well, you know. You are like so confused, and a lot of things are on your brain, in your mind, you know. But for you to avoid depression, you have to do it yourself. Yourself. You have to do exercise. Try to do like exercise. You can walk around your neighborhood. You can go to the gym if you want to. And also some of the tips that can also help you on that is that learn how to talk to people, because when you are depressed, like I'm not a nurse though, I have caregiver, but I'm not a nurse. But when you are depressed, learn how to talk to people, because the more you talk to people, the more you are healed from that depression, you know. And you can like, I was a type of woman that I've gone through a lot in my life, and the only thing that helped me is when I came to this country and somebody told me about being a chaplain. I'm like, I don't understand. In Africa, chaplain are pastors, you know. Then when I came here, I discovered a lot of different thing about that, you know, because I came here, I had a lot of pain, I have a lot of grief, I have a lot of depression in me. So all these things helped me. Like when I was going to school, like doing my PhD, and I didn't really understand what is really like. I didn't understand what I was doing. Like why being in school, they're going to teach a lot of that. I was not really understanding it. And I still felt that I'm so closed up, you know. I can't even talk. I can't even be among people. I work so hard, but I don't have a good body texture, you know. I feel like something is really wrong with me, you know. And I was trying to figure that out. And when I did my first clinicals at the Frederick Memorial Hospital, and I was sent to meet a patient by a nurse. A nurse have to page us like, oh, Chaplain Lois, intern, you have to meet this patient. So when I went beside that patient, I was talking to this lady, and she shed tears. I'm like, people shed tears? I was so surprised. And she started telling me a whole sort of story. And I put myself down and I said, what? So people have problems. People are going through a lot of this. Then why am I killing myself? And that is when I discovered that you have to air out your mind, you know. You have to let it go. You have to open up to people. And while counseling that lady, I discovered that I'm getting healed. You know, I'm getting healed from my depression or from my grief or what. And I was getting healed from all that. And I discovered that, okay, for you to avoid depression is that you have to talk to people, open up. The depression is going to be there, but it's not going to go. The way you open up, you let a lot of things go out of you. You know, you free your mind, you free your brain, you free everything about you, and you feel comfortable. Like nurses, I don't know much about nurses, but the nurses that are the front line right now, they really need that. They really need to air out. They really need to like air out like some of their pains. I was talking to one nurse yesterday night, and she was crying. She called me and she was crying. She said, I overworked myself and I feel like I'm losing it. And she started crying. I'm like, what are you crying? You overwork yourself and you feel like you are losing it. I said, okay, can you get out from that hospital? Just go out a little bit of the building. And she did. And I asked her, can you breathe in? She did. Can you breathe out? She did. I said, do a little bit of exercise. And if you don't feel well, you better go home because you may end up like dying. And all these things help us. When it happens to you, try to abstain from social media. Those are some of the strategies to help you to avoid depression. If you're somebody that you know that you are too depressed and you're on social media, and social media now, we have a lot of things that are going on in social media, people killing, putting a lot of things, and you go to that social media and let's say you watch things or you see things that can even make you more like become so depressed in the way that you can't even. Try to avoid yourself from social media. Try it one day, you're gonna see I've done it. Avoid yourself from social media. Tell yourself that I just want to take a break, like 1 week or 2 weeks, I'm not gonna go to social media. And you're gonna see it. You're gonna discover that you have stayed away from a lot of things that can lead you to more depression. And also try to stay away from people. Stay away from people does not mean that you can relate to somebody. No. Staying away from people is that stay away from people that can make you like go mad, go crazy, people that can remind you of your past, people that can remind you of what you did, because what causes us to be depressed or to have trauma is when you are beside people that always remind you, oh, this happened to you. This is what you did. And you are trying to get healed or you are trying to get over that situation. So you have to just stay away from those people that always like, want to cause you to go back on some of the pains that you're losing. So all those lines are so helpful in our community and even where we are working. And another one that I'm going to talk about is it also reduces your immune system. It reduces it. When you think a lot, you discover that it kills your body. When you are depressed, it kills your body. It kills your sense of thinking. It kills your sense of listening. It kills your sense of talking. If you're depressed, you can't even talk right. If you're depressed, you can't figure out nothing. And you feel like, oh, you have cancer, like you have cancer. Like, your head is not moving well and you can't even figure out nothing. And that is how it also helps to it can reduce your immune system because your body functions. I'm not a nurse, but they are necessary. Your body has to function. But if you are depressed, it stops you not to think. It stops you not to take good care of yourself. So we have to stay away from depression. We have to stay away from depression. And I said about cut out from social media. Now, build a strong relationship. Having a strong support system can help you to activate your social life, which is so important in mental health. If you build a good relationship with people that can talk sense to you, people that can help you, people that can be there in time of your needs, is going to help you. That is why I first of all said that it's not good to be around people that are always going to remind you of your past, people that are always going to remind you on who you were. They are not helping you at all. Now, be among or around people that are going to build a strong relationship to you. People that are going to counsel you, talk to you, listen to you, in that time where you are depressed. And that is going to support us a lot. It's going to support us. A lot of people have been depressed, a lot. When I was a chaplain in Frederick Memorial Hospital, I saw a lot of situation. Somebody is sick. You feel like you are dying. Your families are not there to come and see you, because that is where you need your family. That is when you need people to come around you, to come and tell you, oh, mommy, I'm fine. Mommy, you're not dying. Mommy, you look good. You know, you bring them flowers. They feel good, although they are still in that situation. But it helps them come out from that depression. It helps them feel like, oh, I have people around me. It helps them feel, oh, I still have more hopes to live. Like people who are in the hospice, they feel like at times the doctor can declare that you just have 3 days to live. I've counseled a patient who the doctor said, oh, she has just 6 months to live. Can you imagine that? And I saw the love of the family give that particular person hope to be more than 6 months, to last more than 6 months. And the nurses were really, really so surprised to see that. That is why we have to be among people that are going to help us in time when we need them, in times where we are going through a lot in our lives, in times that we feel that there is no hope, in times that we feel that we are losing it. We need those people to be among us, around us. Another one is reducing stress. How can you reduce stress? Avoid over communicating with people. Stop communicating with people a lot. It helps you reduce your stress. Learn to let go things. When you learn to let go things, it helps you to reduce depression, stress, and trauma. But if you put things in your brain, it's not helping us. It won't help us in no way, in any way. If you keep on accumulating things in your mind, in your brain, it will not help us. It's not going to help you. It's just going to make you to feel more depressed, more like confused, more like you feel like you are dying, like you don't have any use in your life. But if you communicate also with people, you let go things that people have done to you, you let go your worries, you let go your problems, it's going to help you to avoid depression. And maintaining your treatment plan, it also helps you to avoid depression. If you continue to take your medication and never stop taking your medication, like those that are taking medication who are depressed or those that are going through a lot, continue taking your medication, is going to help you. Always practice to listen to music that can help you come out of that depression and stress. Like for me, when I'm stressed up, I love listening to music. That is what brought me, for me, like doing acting or what I'm doing, because I've lived a life of depression a lot, a life of grief. And I was not a talkative. I was not talking like this. But now changing from my pain to who I am today, to the life that I am today, has made me, I can talk to people. I can, be among people. It makes me like, I'm acting, which I never dream of acting. I never dream of doing entertainment. I never. But you know that now you can see that avoiding depression is taking you to something else that you have never done. Something else that is gonna build up your life, build up your social life, build up who you are to make you be more better than before. Make you look more good, Now I can handle my problems. If you make like, there is nothing that somebody can tell me now that is going to make me get depressed. No, because I will always laugh. I'm going to laugh always. I'm going to listen to my music. I enjoy listening to my music. That is my key note. And on this note, I just want to tell us that those that are depressed, please try to follow this skill note. It's going to help you. Stay away from people that won't help you. Stay away from things that won't help you to avoid depression. Stay away from social media. I'm a social media person for now because there's nothing on social media that can make me think about my past or make me start crying. No, because I did overcome all those things. I did overcome it. A lot of us, we are depressed also because we don't want to let go. We don't want to let go things in our mind. When you keep on having things in your mind, you cannot get out of depression. You cannot get out of depression. You have to let go. Even at your job site, when you're at your job site and you feel like you have worked a lot, you have done a lot, just try to look for a little time, go out. If you love music, listen to music, dance a little bit, walk around the neighborhood, you're going to feel that you are coming back to yourself. But when you keep on walking with that depression, you're going to collapse and you're going to die. That is normal, that you're going to collapse. But if you take away all those things and say, no, I don't want this situation to depress me. I don't want this person to depress. I don't want this person to be in my life, or I don't want this person to give me depression. So that is the little thing that I have to share with you people. And let me just say this last one. No one can take you out of your pain. This is something that I just want to say. Nobody can take you out of that depression or to avoid depression. You have to do it by yourself, because somebody is going to sympathize with you when you are depressed or when you're having trauma or when you're stressed up. But nobody can take you out of that situation. You have to take yourself out of that situation. We're going to sympathize. We're going to talk to you, but you have to make up your mind to take yourself out of that situation for you to be able to avoid depression. So thank you, people. That is just a little that I did.
Thank you so much, Dr. Ekwe, and for sharing those strategies. And I do agree with you that despite all the help that you can seek, express your feelings, you do have to do it for you. And that's why we're talking about self-care today, taking care of you first. So being able to express that you're feeling anxious, you think you're probably getting depressed, and seeking help, you are in control as an individual. So thank you for that great reminder. And I believe you had a tribute to pay to your mentor. So give me a few minutes and I'll bring that up on the screen so we can acknowledge him. Just give me 1 second. Can you all see my screen? Oh no. Hold on. Let's see here. Share your screen. That's the screen. Share. Give me 1 second, y'all. So one of the things, like as we're going along, is really recognizing people that we have in our lives that have made a difference, because we all did not get here by just our own struggles. We got here because we leaned on someone or because someone helped to lead us in the right path. So Dr. Ekwe, take it over to pay your
Okay.
tribute.
Yeah, I just want to say a big thank to Dr. Wave, because when I came to this country, as I rightly said, I went through a lot. And if you don't know, people are there to always educate you. He held me in my hands and he told me, because actually when I was in Cameroon, I had my master's in marketing. So when I came here, he was the one who told me, like, you can do this, you can become a counselor, you can become a chaplain. And he helped me in that time for years today and gave me a scholarship, a scholarship, and made me who I am today. And he is like a father to me. He's my mentor, and I owe him that respect. And I want to say thank you, Dr. Bonnie Wave, for what you have done in my life, for making me who I am today, that I can speak in the public or become the woman that I am today. And I just want to say also a big thank to my mom, who have also been like a mentor in my life. She's a woman of God who have also been there for my life. That thank you so much.
Awesome, awesome, beautiful. They say a blessing is not a blessing until you turn around and bless others, right? So I just love the fact that we're able to do that today. So we're going to move on with, is Angie back in? Is Angelia back in? I cannot see
There.
her.
Yep, she's there.
All right.
Hello, hello.
Hello, dear. So we're gonna go back to you, and I do not have your
My tribute, but I can give that without any help.
All right. Go ahead and give me 1 second.
Oh, she wants to put my mugshot up. Oh.
Give me 1 second.
Yeah. No, from current slide.
That's what I did, sister. All right, what happened?
Perfect.
There you go.
All right. Well, Dr. Juanicia, first of all, I'd like to thank you for the invitation to join this great panel of women to just share about self-care from the perspective of gratitude and mindfulness. And so that sounds pretty simple, but I have to be honest with you, I think those are some pretty heavy topics to talk about today. So I tried to figure out how would I share this and just keep it real simple. Now, first of all, when we think about gratitude, we think about being thankful and kind of look at it from the perspective of mannerism, how we were raised. When someone gives us something, we say, oh, thank you so much. We say, it's a show of gratitude. But gratitude takes on two parts. So it's an action and it is also a feeling, the way we choose to see the world, basically. That is gratitude. And so I wanted to also just share a quick definition of gratitude. And it just says being thankful and basically showing a positive response towards a kind act that's been done to you. So if I bring you tulips and that's your favorite flower, you're likely to say thank you. And we would consider that to be a show of gratitude. But even today, as we face the challenges of COVID-19 and so many other things that it impacts, we're still challenged with the task of being grateful. And to some of us, we may feel like, grateful for what? Are you kidding? Some of us have been personally affected by COVID-19. We've lost coworkers, we've lost family members, and yet I'm saying today to be grateful. The Bible says it like this: in all things to give thanks. And even there, when you're happy and things are going well, it's easy to be thankful and to have a spirit or attitude of gratitude. However, when things are not as you'd like for them to be, the challenge is so much greater.
to be grateful. Let me see. I think I'm not on the camera well. Okay, it's so much more difficult to demonstrate attitudes of gratefulness. But again, it's more than just, the manners of remembering to say thank you or to help someone in need. It's how we feel, and it's really our choice to be that way, to cultivate that attitude. So first of all, I want to take it off to the left a little bit. I've created my own little setup here so I can have a quick little display. So some of the things that challenge us right now from looking at life through the lens of gratitude are, and just so you know, these are my little homemade props, and it'll make sense in a minute. All right, so some of us are faced with some physical challenges, right? So we have people who are in need of just the basic necessities, food, for instance, to feed their families. So that's a challenge. And when you're hungry and you're used to being able to go to the refrigerator to grab a bite to eat and you cannot, and you need to rely on a complete stranger to set up a food giveaway in order for you to be able to feed yourself and your family, it's a challenge to be grateful, but we need to be grateful. Okay, so physical. Then we have the challenge of our safety, and safety not just from the perspective of being able to close windows and lock doors, but our financial safety. So as I said, with the impact of COVID-19, many people have lost their jobs. So that directly impacts our finances. So how can I say, be grateful when you are challenged to be able to purchase food because you have no finance to do that? And then, of course, for our safety and for the safety of the people that we serve as nurses and in other industries, even as a chaplain, Dr. Lois, as you mentioned, we're being asked to stay apart. So social distancing, and that directly impacts our feeling of belongingness. So the feelings of, being connected. And so if you live alone, like I live alone, it's important for me to connect with people by phone, through social media and other ways, because going to work, I see people, but those are not the people who are in my personal circle, people who help me to feel whole and who support me in the things that I do. And so then there's self-esteem. That's all impacted by this whole COVID-19 thing. And it's so important for us as, again, folks on the front line to feel good about ourselves and good about the mission that we find ourselves facing. Self-esteem. So we need to feel every day that we're doing something that makes a difference for ourselves and for the people that we're serving. And then lastly, it's the self-actualization, which is when we actually meet our goal of doing the thing that we had hoped to do. So some of these things we will do over a lifetime, and then there are other things that we can just do day by day. So I'm going to slide my little display off to the left there. So you may have recognized by some of the terms that was my version of Maslow's hierarchy of needs. So I thought it was kind of boring when I learned it in school, but it's relative. All right, so being grateful, I think it goes hand in hand with mindfulness. And mindfulness simply means being aware of yourself, really, what makes you tick, being aware of your surroundings, like you probably heard it said many times in your life, like if you're ever going somewhere. I know for me, I've lived in different cities in my life, and if I would tell somebody where I was going or what I was doing, they say, girl, are you kidding? You're going down there? Or, I'm in New York and I'm on the subway by myself. Like, you have got to be kidding. Nobody. Yeah. So I may not have been quite as aware of my surroundings in that point in time. Now, as an older person, I've lived a little more, had a few other experiences in my life. I am a little more mindful about what I will take on, where I will go, and also whose company I keep. So again, like this ties in directly to what Dr. Lois was saying, and that is that you want to be careful about the company that you find yourself in, the things that you entertain. And when I say entertain, I don't necessarily mean on the big screen what you're watching on television. I mean the things that you listen to, like when folks are around and the only thing they're talking about is everything that's negative. We need to find a way to counterbalance that negative with the thing that is good. So that's mindfulness in a nutshell. But to bring it, to bring it in some more perspective, like Denise Washington happens to be a personal friend of mine, apart from being an awesome nurse. And that is someone who I know that I can call when I am really about to lose it, because I'm like, oh my God, I need to be around some people, like my people who matter to me. Or either I just need to have somebody to stand in the gap with me, maybe to say a prayer for me or just to encourage me. And so because we take on these roles that require us often to take the lead, even when it may not have been our intent to take the lead, because of the profession that we find ourselves in. We are leaders, and then also some of us also have the gift of leadership. It's almost like a double whammy, and you like can't turn it off. But sometimes you have to dial it back, and when you cannot do that easily on your own, you need someone to be able to say, "Girl, you need to just slow down a little bit, or let that go. It's okay if you don't do that today." And then to come back to it. And sometimes things don't go as we hope that they will go. And we're sometimes challenged with being able to accept the fact that although something didn't happen the way we had hoped, it's not necessarily a failure, but it's absolutely an opportunity for us to learn from whatever the experience was, and then to move forward from it, to build on that thing, whatever it was, and to start there and to do better. That is also an example of mindfulness. So here is something that I recently learned that helps me as far as being mindful. I am grateful that I happen to live in a community where I have windows all around. And so my first order of business every day is to always open all the blinds. Light makes a big difference in our mood. And that's part of how we see, that also impacts how we will start our day and what our perspective will be like. It's totally up to us to command our morning every single day, to decide what kind of day we're going to have, because we can rest assured that although we don't know what the next few minutes or the rest of the day holds, there will be a challenge in that day somewhere along the way. But it is really up to you to decide how you are going to respond to it. How I feel about it may be one thing, but how I respond to it is totally up to me. So meditation. Now, I don't know how many times folks have talked to me about meditation. I go, oh gosh, meditation, right? But that's really not meditation. Meditation is just simply being able to focus on a single thing. It basically quiets your spirit and your mind and allows you to intentionally focus on just one thing. Maybe the thing that you're focusing on, maybe it's a thought, a positive thought. Maybe you're focusing on your breathing or the sound of birds. So one of the other things that I have in the morning, apart from the sunshine, is that I sit in front of the window to have my tea or coffee in the morning. That is when I get up, and plenty of time to do that. Let's be honest about it. But to just feel the sunshine on my face, and then also to hear the birds chirping. I think that that is just one of the greatest gifts. And I just try to sit and just think about something that's positive rather than jump up, bathe, get dressed, and run out the door. And I find that for me, that makes a great difference. And I really wish that I had begun doing that much sooner in my life, but I did not, and only really just in recent months. And it's easier and easier every day. At first, I really couldn't even sit still for like 5 minutes. It felt like, oh my God, my brain kept on just wandering off. But for me, it's important for me to take care of me so I can help me and I can be good to me in order that I can be my best for anybody else that I'm going to impact. Because my hope is that the impact that I have on the lives of others is positive as the impact that other people have had on my life. So again, gratitude and mindfulness go hand in hand. And those things help us to stay centered and to be well in our minds as well as whole in our bodies. Because when we're stressed, there's so much going on, and none of it is, for the most part, really positive in the way it impacts our bodies if we allow it to go on continuously. So we have to take control. We have to know when we're in situations that are too much for us. You know, let folks be okay with saying to someone, I would like to help you. However, you know, because if it's just too much for you, it's too much for you. You're not asked to sacrifice yourself for the well-being of others, not in that way, especially when you recognize it. But sometimes we don't recognize it, or either we feel something that's not right and we go, and we just blow it off. Those things, those little warnings that we get, and something doesn't feel just right, that's our warning to pause for a moment and recognize that we might be in a situation that's a little too much for us. So be grateful every day for what you have, your health, your well-being, for your family, for your friends. Even though we can't physically be together, we can be together through social media. We can be together through sending cards to let people know that we care about them. If folks have, you know, Facebook pages, Instagram, all these great pieces of technology that we may have never used before allow us to remain connected. So this whole little Maslow's hierarchy of needs does not have to be abandoned in this time. We actually do have opportunities. Maybe not every single day do we meet our goals, you know, where we're self-actualized, maybe not every day, but we can be on our way to doing that. So if I don't have food today, maybe you've made enough spaghetti to feed 6 people and there are only 4 of you in your home. You can share that with the neighbor. So that's an opportunity to help someone, and an opportunity if someone shares with us for us to be able to be grateful. So again, gratitude is an action and it is also a behavior. So it's a feeling, all right? So I would like to just acknowledge 2 people very briefly who I didn't send in a photo, but just their names, and to say a little bit about them, who definitely helped me in my nursing life. And those 2 people are, one is Mary Ann Bonner. She is probably one of the first nurses who I ever saw doing nursing from a different perspective, and that was explaining the importance of understanding and knowing regulations, to understand the importance of leadership and the role of leaders. And one thing she said to me that always stuck to me is that leaders don't wait for the problem to come to them, for somebody to bring it to you and tell you all about it. If you know something's up, you go to the problem, you handle it. And that was what she told me. And I remember I was scared out of my wits, but she never blinked once when she said it. And she really meant it. And she held my feet to the fire on that. But she was like, if you want to be a leader and be in a role of a director of nursing, then you need to behave as a leader. Otherwise, folks will run over you. It was a saving grace that she told me that. And so Mary Ann Bonner, I really appreciate her, in a very humble spirit. And so here's the other person I'd also like to acknowledge, and it's Petronella Barnes. She is, we call her Pet, but the thing that was so awesome about Petronella Barnes is that I had the privilege of working side by side with her in Bay Health ICU. And before coming to Bay Health, I worked in an LTAC, and I only went there just for the purpose of getting used to all the noises that I would hear in the healthcare environment that just really just made me so nervous, like all the alarms. And the thing that Pet told me, I had a patient who was on a vent and had an A-line, and the vent started alarming. I was just like, I think I was just paralyzed. Like I couldn't quite figure it out. And she just came and stood next to me, nothing rushed about it. And she said, I was looking at the vent. She said, okay, so you looked at that. She goes, look at your patient. And I did, but the vent was still alarming. And Pet said, okay, so we see the settings, you know, that is what it is. She said, but you want to take it from the patient. How does your patient look? Do they look like they're in distress? You know, because I felt like any second, like everything was going to blow up. My person was going to code, all of that. And she is just saying, assess the situation. And the situation wasn't the vent. It wasn't the vent that I was there to take care of. It was the patient that I was there to take care of. So nurses like that who taught me how to put things in perspective, how to think critically, and not to run from situations, but to stand there and to give my best nursing judgment. And whether someone agreed or didn't agree, is that I needed to be able to support my own assessment and to be comfortable with that. So Mary Ann Bonner, Petronella Barnes, 2 aces who made a big difference in my nursing profession. So thank you very much for your time. Thank you, Dr. Guarnesia, for the invitation.
Wow, wow, wow. Thank you. Thank you so much for those empowering words and for acknowledging your mentors and those who have helped you in your career. But most importantly, I loved your own version of the Maslow's hierarchy of needs. You know, we talked earlier before you came on about using the nursing process to do our self-care plan. And you could not have said it any better, because to put that in perspective, you know, the basic needs such as food and safety, finances, and all of that are really threatened at this time. I personally was up at the MOT Senior Center yesterday. I really didn't know what to expect. I just knew they had called for some masks. And when I was going, I thought I was going to see a room full of people not thinking the lockdown and the social distancing. But when I got there and saw these elderly people standing in line to get food, just to have food on the table, made me really think of how blessed some of us are. We complain and whine about things we have no control over, but here are people out there, elderly and kids, who are not able to eat right now, because the only way they will get food is in the school, during school, when school is open. And the elderly that go out into daycare centers, and that is where they will eat a meal. So as much as it is heavy on us as nurses, let us just try the best we can to still be grateful and to be mindful and become present with us in these difficult times. So thank you so much for sharing that. That's new on my my new version of Maslow's hierarchy of needs. I'll always remember that.
Books and colored paper.
Sorry?
I said books and colored paper.
Absolutely, absolutely. And like I told Gifty earlier, I said, you know, the joy of an educator is when they see their students doing well. I've always reminded you, but I am so, so very proud of what you have accomplished. I had no doubt you will make an excellent nurse, and you have just done that. So I salute you, and I bless you to continue doing what you're doing.
Thank you.
You're welcome. All right. So the next person on the list is my sister, Dr. Nadine Richards, and give me a minute to bring up her picture as I share her bio. I am really getting used to this technology now. There you go. So can everybody hear me? Am I on?
Yes.
Yes.
You're on.
Yes.
So Nadine, she's got a long bio, sis. So we're gonna cut this short, but Nadine has been a practicing nurse for over 14 years. She's a family nurse practitioner, and she's board certified by the American Academy of Nurse Practitioners and currently licensed to practice in the state of Delaware, Pennsylvania, and New Jersey. And Nadine has practiced in numerous and continuous care clinics since the completion of her certification as a nurse practitioner, and she earned that through Widener University. Nadine's philosophy is building relationships with people to understand their holistic needs and work collaboratively with each individual to create the best treatment modality, incorporating their cultural and religious beliefs. And I am so honored to introduce our most recent and so proud, just defended her dissertation, should be graduating next weekend, but because of the lockdown, she will have a virtual graduation ceremony. So please help me welcome our newest doctor, Dr. Nadine Lindsay Richards.
Thank you.
Congratulations.
Thank you. Can you hear me?
Yes.
Okay, great. All right. Thank you so much, Dr. Gwamisia. It's pretty difficult to go after these wonderful speakers. I'm not sure why she put me in this position, but I'll do the best I can considering what I have, okay? Now, I myself, like the former speakers, I just want to give a shout out to our nurses on the front line that are actually risking their lives on a daily basis. We just want to say thank you to them. We're with them, we support them, and we just want to continue this fight. There is work to do in the community. And we just want, like I said, so we just want to keep supporting each other and try to work through this. And so my topic today, as Dr. Gwamisia is to talk about how do we lead effectively while fostering self-care. And it is important as clinicians that we're doing what's right for the patient, but do we always do what's right for us? And so I tossed and I turned last night and I tried to figure out how to stagger this, but one of the things topics that I wanted to bring out was that we have good leaders as in the nursing profession, and a good leader is someone who inspires others to pursue their goal. A leader normally has distinctive qualities like ability to handle stress, and they possess dynamism. They encourage their staff, and they have integrity. And that is most nurses that I know. The irony, though, is that although nurses are well informed and they're trained, they're informed caregivers, they often forget to the relevance of self-care. And we know that self-care is really important. For nurses, self-care begins with awareness of personal needs that include cultural needs, spiritual need, emotional needs. In order for our entire being to be positive, to strive to achieve equilibrium, we must find ways to create those needs. As healthcare providers, we must be well in order to effectively give care. There's a saying, we must practice what we preach. If you are not healthy, then how easy it is to keep your community healthy. And as nurses, that's what we do in the community. And for those of us who work in acute care. So nursing is a profession of providing care. It encompasses autonomy, their care of individuals and communities on a global scale. Nurses include health promotion, illness prevention, care of the ill, individuals with challenges or special needs, and those that are facing impending death. So clearly nurses are taking care of a lot of different people with like different dynamics going on, right? So we're a well-rounded group of people. Therefore, to be a nurse, one has to possess never-ending diligence and commitment to the profession. The question is, are nurses exercising diligence and commitment to self-care? And too often, I am myself, I'm guilty of that. I remember in the past, I would run from one job to the other, not focusing on the fact that later on, it might affect you in some way or the other. And currently it is, because I cannot get enough sleep as we're speaking this today. I remember days I used to work 16 hours, 18 hours, 20 hours per day. But now I'm really happy I find that I'm happy to go home because I get tired so easily. And I now acknowledge that back then, I did not do as much self-care, and it was actually to my disadvantage. So the focus of nursing. Nursing is a profession within the healthcare sector that is concentrated on individual families and communities, so they attain, maintain, and recover optimal health and quality of life. As a reminder, nursing practices in various specialties. We have nurses now that are working in so many areas and offering different level of care. The authority and the responsibility that goes with it, sometimes it goes without saying. Nurses are challenged. One of the things that I encourage nurses to do, if you're given the responsibility, ensure that you have the authority. You can make certain decisions that will benefit you, your staff, depending on how, like I said, your unit or your organization is set up. However, as nurses, we should endeavor to secure optimal health for self-care. By doing so, we practice what we preach. I said that earlier, right? We practice what we preach. We should endeavor to do that. So we know that nursing as a profession has existed throughout history. It has evolved over time. Today, nurses are the most trusted healthcare professionals with significant treatment and medical care of the sick. But what about us? As nurses, we become patients too. What about us? Currently, we are dealing with the COVID crisis, and we're seeing we're seeing fatalities. We're seeing nurses losing their babies. We're seeing a lot of things happening with us as individuals. So at this point in time, we all need to be refocusing how as nurses do we protect ourselves. And I know we're a very resilient group of people. A couple of weeks ago, I happened to witness the nurses in New York wrapping themselves in garbage bag. And I thought, look, you work with what you have. It is okay to do that. As long as you're protecting yourself. It boils back down to self-care. This is all about self-care. Let us never exclude ourselves from the rich history that we have created. And I just wanted to quote Florence Nightingale, which is one of our founders. She believed, her philosophy is that we should provide a safe caring environment that promotes health and well-being. Health and well-being. While we promote health and well-being to our patients, our communities, the family members, because not only are we taking care of our patients on a daily basis, but we're taking care of family members. And now there's a COVID crisis. Maybe the families are not allowed to come in, but they will call in. So we are still taking care of them via telephone, video conferences, and you name it. So while we do that, it is of utmost importance that we are not ignored in the process. So while nurses lead the charge to create healing, we must not ignore the need to promote diversity, equity, and inclusion, as this will help to create safety nets for self-care as well as our patients. Diversity will help us to create opportunities to provide better patient care and care of each other. Through diversity, we'll get to understand each other. Through diversity, we can support each other because we are culturally aware of not only what's going on with us, but what is going on with our colleagues. And that is really, really vital to our healing, our health maintenance, as well as that of our patients. Equity demands that we try to get a seat at the table. And by that I mean, we need to get involved in things like policy making. Know who in the organizations we should talk to in the hallways. As one past professor told me, she said she was getting left out of what was going on in our organization because she was now teaching remotely, and she was missing all the things that were going on, the different committees that were being formed. And what she was told is that, look, these conversations begin, these committees begin on the hallways. And unfortunately, she was not there physically, so she was unable to be a part of that. I want to emphasize that we need to get a seat at the table, because that way we can make a decision. That way we can help to decipher, okay, this might be better for my community as opposed to your community. This might be better for somebody of my religious status than your religious status, because at the end of the day, we have a common goal. The goal is we care for our patients while we're fostering the care of ourselves and each other. Equity demands, okay, then we get to the table, okay. So let us take a look at the COVID crisis. And as Dr. Gwamisia mentioned earlier, we are looking at a situation where minorities are exponentially, it is mind-blowing. I'm trying to find words to nicely describe it, but we're exponentially dying at outrageous numbers because of lack of access to healthcare as we know it, lack of awareness as we know it, and we have been dealing with that for decades. And so some of the things that we need to begin to do is to begin to form organizations, begin to figure out among ourselves, where do we go from here? How do we help to create awareness in our communities? And like this begin in the church, this begin in our like I said, on the hallways, this begin at dinner. We can have this conversation at lunch. Dr. Eunice and I connected, and I will tell the story at the end of it, but she and I connected because we both had a passion for the need to create diversity, equity, and inclusion among healthcare workers, communities, in order for us to have stronger societies. Inclusion. The power of inclusion helps us to achieve equity because it unlocks potential and increasing productivity in the workplace. It will also help us to locate resources that might be available. How many times do we take care of someone who does not know what resources are available? And I will share a story. I had a patient a couple of months, maybe a year ago. He came to me and he said, well, I need a refill of my medication. And so I decided to go through the medication with this gentleman. As we went through the medication, I realized that he was cutting, because the last prescription had been months prior. He had been cutting his metformins for his diabetes and his hypertensive medication. And so I sat with him to find out, why are you cutting the medication? And he said, I don't have insurance. I am trying to make them serve longer. Now, I had a good talk with him. I pulled up a list of the pharmacies that has the $10 list, and I pulled up the other places that had a $4 list. Now, both his medications were on the $4 list. So he could have been getting his medications so he could take them at regular dose and frequency. However, he was absolutely unaware. And so as leaders in our communities, in the healthcare sector, I implore us today to try to help to shift the focus to people who are unaware of the resources that that might be available to them. I was looking at a study, I think 2 years ago, and one of the things that came out of the study, disturbingly, Caucasians women with reproductive cancer were affected 3 to 1 in the Black population, but 5 times as many Black women were dying from reproductive cancer as Caucasian women. And a lot of these issues goes back to the fact that there are just totally unaware of where resources might be, what help they may be able to derive. So let us endeavor to foster self-care again through assisting our community, each other, helping others to understand where they might be able to find resources to assist. And with that, I am about to shed light on some statistics that I have here. Now, nationwide, the Black population is about 13.4 to 14%, and currently there are an estimated 3.8 million nurses in the United States. However, of that, Black population is 9.9%, and now bear in mind that the Black population is an estimated 14%, okay? So we are definitely lagging behind, okay? All right, in the Hispanic population, we are looking at a current 4.8%, and it is the Human Resource and Service Administration is projecting that the Hispanic population will see a 1.2% growth up to 2030, and the Black population will see a 2% growth by 2030. Therefore, we have to bear in mind that we are still behind the targeted goal, because right now we should be sitting at least 13 to 14% of the population. Let us be reminded that the current COVID crisis that we're dealing with, the pandemic we're currently dealing with, an estimated 50 to 60% of the death, the mortality rate, are people, Black and brown people. This is basically illustrating that there is work in our community to do. While we do that, I will go back to emphasizing that we also need to be mindful that our healthcare workers are dying, and we need to protect them. We need to be working together. According to Healthy People 2020, in order for us to create improvement in healthcare outcome in the American society, we need to diversify the workforce. We need to ensure that we're encouraging others to come into the profession, and that way people will be able to relate to each other. And therefore, because what studies have shown is that if you're comfortable with your caregiver, your healing process is a lot better. Okay, and I remember, I will tell a story, another analogy that I have. I remember I work for Bay Health as well, and I remember there was one particular morning, there was my night colleague was giving me a report, and as I stood at the door, and I was stood at the door, I was about to walk away, and I looked back, and the patient looked at me, and this was an African-American lady, and she looked at me. And I said, "Are you okay?" with my colleague who was Caucasian standing there. And she said, "Yes." My colleague went, and I stood there. I looked at her and I said, "Ma'am, are you okay?" And she said, "No." I walked back and I realized she was having an issue, but she was not comfortable relating the issue to the night nurse. And as healthcare providers, we embrace people for who they are, what the religion they practice, what they believe in, their cultural practices. We try to embrace all that. And so we want to just cater to the needs of each patient, because each patient, the need Each patient need is unique to that individual. So we don't want to like throw everybody into a generalization situation like, okay, if it works for this one, it might work for that one. Because currently the night shift nurse gave good care. It just did not, she just didn't feel comfortable relating. So when I came on, she was able to relate to me. And we need to have that option as healthcare providers and healthcare recipients, because like I stated earlier, a lot of us now as nurses, we are currently on the recipient of healthcare. We're receiving care. So on a final note, as nurses, let us endeavor to focus our self-care, focus on self-care so we can achieve optimal health, we can achieve togetherness, we can have health maintenance through the support of each other, be it culturally, be it religious. We also need to be able to carry out research on healthcare resources that are available for assisting our communities that are in need of help. We need to focus on developing understanding of each other, learn how to embrace the power of diversity and inclusion. Always remembering, together we are stronger. It is important also to find that individual you can speak to, find that shoulder you can cry on. And if it becomes challenging, don't be afraid to seek professional help. And I'm aware that in the Black community, seeking mental health, there's a stigma surrounding seeking mental health. It is okay to seek mental health. And we need to let our patients and our colleague understand it is okay. Let us seek some professional help. It is totally healthy to do so, because at the end of the day, what matters is that we are maintaining good health. I implore all my colleagues that we must unite to create a health care system that has equality, equity, inclusion, and diversity. With that, I say thank you so much, Dr. Gumesia, for giving me the opportunity to talk to my colleagues out there today. Again, I embrace this opportunity. I thank you. And I hope moving forward, we will all be able to work together in unison so we can begin to change the dynamic of the current inequity that sits, especially in our Black and Brown communities. Thank you.
Wow. Thank you. Thank you so much, Dr. Nadine.
Can I do my tributes, please, before I walk off? I'm sorry. Thank you.
That's all right.
Okay, so I want to pay tribute to, her name is Eileen Jackson. She is the nurse, she is the forever type nurse. She taught me everything I know about nursing at the beginning of my career. And I just want to give a shout out to her. She's been a nurse for as long as I have lived, which is a while back. I've been around for a little bit, and I just want to say shout out to her, shout out to all the good nurses. I also want to take time out, I'll make it fast. Shout out to my friend and colleague, Mary Nanjo. We met in undergrad and we have been friends and colleagues. She helps me, keeps me grounded. I always say we're like oil and water, because I get fiery and she'll just keep me shut down, and that's okay, right? Because we all need that balance. And I just want to say thank you to her. This is Sterling, my current partner, study partner. We share a vision of improving healthcare in the underserved population, and I just want to give a shout out to her, and thank her for helping me, show me how to use computer. And lastly but not least, Dr. Gumesia, I want to say I have to give you a shout out today, and I will give the story real quickly. I have to tell it all the time. I told her that she was going to be a game changer in Delaware. I was at work after I completed my master's degree, and I was a new nurse practitioner. And I just, was ready to transition to my new role. And I was getting frustrated because the calls were not coming from the employers fast enough. And I just wanted to go work as a nurse practitioner. And as I was at work one evening, Dr. Gomesia showed up, and I did not know her name. This lady showed up and she was smiling from one ear to the other. And I approached her and I said, "Hi, sis, how are you? Good evening." And I said, "I don't know who is happy to come to work, but you look like you're happy to come to work." And I looked at her name tag, and I can't remember all the acronyms that was on it, but I looked at her with a PhD coming to work, humbly coming to work with a smile on her face. And I thought, Nadine, go sit somewhere with your master's degree, be quiet. That moment, she brought out the spirit of humility. She absolutely helped me to realize that, look, it's not about your status in the career that we have. It's about what you bring to the table, how you can relate to the patients, how you can provide the care. Thank you, Dr. J. You're a game changer.
Wow. Ooh,
Yes,
all right.
he is.
I'm speechless on that one. Well, thank you, Nadine. Thank you so much. Thank you for the great presentation. And you could not have said it any better. There's a lot that you said that really comes real close to my heart, from the diversity to the poverty to the underprivileged communities, that we really do need to do some work. Can somebody put themselves on mute? You have some noise in the background. Dr. Lois, I believe that's you, please.
That's me, I'm dead.
Can you mute your, it's bringing some interference. No, can you mute yourself?
Okay.
Thank you. So the statistics indeed are overwhelming, and the number of healthcare professionals that have died from COVID-19 are just unimaginable. But in a nutshell, all of this boils down to the plan we talked about earlier, having the infrastructure in place. And really the knowledge deficit is affecting our communities, the disadvantaged communities more so than anything else. So I think that each and everyone on this call and everybody listening as leaders in the community have work to do. It doesn't always start from the top. Sometimes we have to do things from grassroots. And that even works better from a point of building trusting relationships with the people and communities that you're working in. So let us just take these presentations and the ideas brought forth, not only about ourselves. Yes, we are taking care of us because we believe that health is wealth. And when we're healthy, we can do more for others. But let us just think deeper as to how we can really start to change the conversation, as to how we can really infiltrate our communities and provide that knowledge and sit down with the less privileged and say, hey, what is it that you need? And recommend some resources and help them find out where those resources are, because there are resources. They just don't know how to go get it, or they just don't have the self-esteem to go out and look for it. So let us be helpful. And let me just see if there's some statistics here. Nadine got me, I wanted to cry. And Connie said that's for true. Let me just see if there's, and Linda said, congratulations, Dr. Nadine. Statistics show that healthcare providers are worst at self-care. We all have to do better, be intentional and consistent at practicing what we preach. Isn't that true? And I am very guilty about that. I am very, very guilty about not taking care of me. And we just have to start realizing we cannot carry everybody on our backs. I personally, as you all know, experienced this earlier on this year with my hypertensive crisis. And it dawned on me that I got to slow down. What if this was my last day? You know, as I shared with my sister Linda and Agnes sitting with me at the hospital, was I suddenly realized before I left my home to go to the ED, to put my makeup on, because I felt, wow, I can't even, my neck muscles are tight, but let me put my makeup on just in case this was my last day. But as I did more reflection after I survived the situation, I thought about my children. and everyone that relies on me, because I could see the chaos. Linda had to go out and get me food to eat because my husband had to go home and be with the children. What if something worse had happened? So sometimes we need to stop and think of us. It is okay to say no. It is okay to be selfish because you need that time for you and you need to rest and rejuvenate, as someone said earlier. You need to relax and get your faculties together to keep it going. And that is one of the positive things with this COVID-19 for me. It's given me time to really reflect and do things that I wasn't doing because I was busy running between what I'm doing with my kids, my daughters, dancing and flying left and right across the state. So we got to be grateful and be mindful and present with what is going on with us and the feelings that we're currently having based on what is going on. So I thank you all so very much for all these contributions, and we got to move on before we run out of time. So our next speaker is somebody who is dear and near to my heart as well. Not only a former student, but she is my daughter. She is a mother, she is a wife. She's a nurse informatics, earned her bachelor's degree from an HBCU. Yes, HBCUs do put out good students and quality students too. She currently works in a local Bay Health hospital and in the role of a nurse informatics, doing some great things. And so she's coming to us today to talk about leaning on God, tips on how to navigate life during the pandemic. It could not have been anyone else but her to talk about this topic because I have seen her grow, I have seen her mature, and I've seen her get saved. So please help me welcome Connie Aja. And of course I got excited and forgot to share her picture. So I will do that before she comes on. So hold on, guys. All right, so there she is.
Hi, everybody. Dr. G, you got my heart pumping. I'm scared. I'm like, oh my God, am I qualified to even talk here? But I'm so excited to be part of this forum this afternoon. And it's a privilege and an honor to be amongst outstanding leaders as you all the speakers have been so wonderful, and it's a blessing. I want to give a shout out to all the nurses out there who are facing this thing head on. It's not easy with all of us. So as Dr. Eunice said, I do not practice bedside nursing right now, but my past experiences have led me to understand what we're going through at the bedside right now. We are familiar, nurses are familiar with seeing people dying, you know, but at the same time, we haven't seen such numbers of people dying at once. And that could cause a lot of PTSD. It could cause a lot of stress and trauma in our lives. Like Dr. Eunice said, she has seen me being saved. I've personally been on a spiritual journey in the past 3 years when I surrendered myself to Christ and gave it all to him after experiencing some trauma in my life myself. This process has led me to develop a passion for spirituality. It has led me to develop a close relationship with God. And in knowing who God is, I started seeing who I am in his eyes. And that has given me a voice to speak out to other people, to other, especially women who may be going through a lot of stuff and feel like they're not being seen or noticed. And I know a lot of healthcare workers are feeling the same way right now. And my topic for today, but when we lean on God during these times, we know that there's a higher power that is bigger than all this craziness that's going on around here. And I know not everybody is a believer. But one thing as a believer, as a healthcare worker and as a believer, that we have an advantage of is the gift of salvation. And that is one of the things that we can lean on. As my topic states, leaning on God, what are the tips that will help us navigate this pandemic now and even afterwards? So there's chaos going on. The news is real. People are dying for real. At the same time, do we choose to walk in fear or faith? I personally choose to walk in faith. It is hard, but at least I have somewhere to look to. I have who I can lean on, and that is Jesus Christ. That gift of salvation itself is a great gift to us as believers in this time. Not everybody has that. So we have to know who we are and whose we are. We are his children. He has given us the gift of salvation, which says that so long as we believe in him, we call on him, he will never fail us. He will never leave us alone. So in this time of stress, fear, and anxiety, I implore us to walk in faith and not in fear. It is okay to cry. And personally, what helps me is pray, is worship. Because in that place of prayer or worship, you're letting somebody else take over. You're coming to him, even in tears, that I can't do this. But you know that he that is above all will do it for you. So before you go to work, take some time. Many of the leaders have already spoken about meditation. It is very crucial, especially during this time. Start your day right by meditating. Spend the first 15 minutes of your time. Somebody talked about commanding your day, because that's how you respond to your day. If I've realized that the days that I take time to intentionally meditate on the word of God, my first 15 minutes of my day, I know that day is not in my hands, but it's in the hands of somebody else. And that helps me a lot to navigate all the stress that goes on. So first thing I do in the morning is I wake up, take a glass of water, and you can easily access the Bible either by listening to it on your phone or paper Bible if you still have it, you know. And when you listen to the word of God, what is meditation all about? It is reading the word of God, thinking about it, and then speaking it to yourself. What are the promises in it that will carry you through that day? You know, so that helps me a lot. I've talked about worshiping. When we worship, you're immersed in his presence. Focus your whole mind, body, and spirit. Focus your mind in that time, in that moment. Forget about everything that is going on. And do you know what that does to the enemy in your mind? It tells him, it tells whoever is that distracting you or whoever tells you the lies, we know the enemy. It tells him that though you are going through this storm right now, there is somebody who can see you through. There is somebody that you're leaning on that can see you through. I also want to remind us that God has not given us a spirit of fear. No, he says it so many times in his word. Fear not, or the word fear is written in scripture 365 times. Why is that? Because for every day of the year, God wants us to know that he is with us, that we have no reason to fear. It doesn't matter what the enemy is telling you that day. It doesn't matter what the news is saying. Take your mind off it. Because the Bible says, God has not given us a spirit of fear, but of
Connie, I think she's having technical difficulties.
It's probably buffering. It's probably still recording her though.
Okay, we'll give her.
We are able to comfort those who we are able to comfort those who mourn. When we comfort those who mourn, we find peace. What does that do? What does that do to you? It helps you find peace in that place. So pray, praise, and worship. Meditate on the word of God. It will help you navigate through this crisis. Another thing is you have to evaluate your belief in death and dying. When we're in school, we're taught about taking care of patients when they're in the process at the end of their life. This is a time for many of us as healthcare workers to evaluate what our belief is in death and dying. What do you believe happens when somebody dies? Do you believe there is life after death? And if you do, guess what happens in that moment when you're with that person? It is okay to cry, like I said. It is okay to mourn with them, rejoice with them when it's time to rejoice. This time that die, and most of them don't have family members there. You are the last person that is there. As a faith believer, what you should do, if you believe that this person has life after death, what you should do is lead them to that place. You are the last one that they are with there. And I strongly believe that will give you so much peace. Yes, you may cry because we are human, but it will give you peace knowing that you've led somebody to their final destination. You were the last one there. And another thing is it is okay to talk about your faith right now. Nobody knows what they should do with this crisis. It's guesswork here and there, you know. But because, like I said, our gift of salvation, you can share it with your coworkers right now. At the beginning of a shift, you can start with prayers. Open it up to them. You never know who you're encouraging. I've seen a lot of stories on social media and stuff, how people are beginning to lean into God. And that's when you look at the whole picture, there's a reason for everything. Maybe this is a time that God wants to draw most of his children to him. And for those of us who believe, this is a time to be real, true witnesses of his word, of the gospel of Christ. In our organization, we have started meditation and prayer time, 1:30 on Fridays. You can log in or call in. That has helped a lot of bedside workers. It has helped a lot of nurses to just, it doesn't take long, 10 or 15 minutes. And that's a practice we just started because of what is going on right now. And I pray that we don't stop, because you're never tired of praying, you know? So those are the things that we should be doing right now, that we should be leaning on God in navigating this crisis. Stand on your faith. What is faith all about? It's believing that God has done what he says he has done, and he will do what he said he will do. Stand on his promises. Do not focus on the crisis. Focus on his word. His word is the truth. Take one scripture a day in your meditation and let that speak to your spirit. Let that speak to you throughout the day. And like somebody said, when you come home, leave it all at work. You know what they say, that our stories is power, like Michelle Obama says in her book, Becoming. So I've experienced firsthand, and I want to share this testimony with everybody that is listening right now. I was out of work for 12 days after experiencing symptoms of COVID-19, even though I tested negative, but I had all the symptoms that you could think of. When I came home, did I cry? Of course, yes, I cried. But what made me go through it without fear was the fact that even if I have it, God is going to keep me. And let me tell you, he always fights for us, even the unseen battles. The week that I started having symptoms, a lady from church who has never called me before, she called me that day. She didn't even know I was a nurse. She didn't know I was still working. She just called me to say she was thinking of me and she wanted to check up on me and my family. That was Monday. And I told her that I was at work, I couldn't talk much. And she said, oh, are you a nurse? I'm like, yeah. She said, okay, I'm gonna pray for you. Just give me a few minutes, let me pray for you. And when she prayed that I should be protected from the disease. But even if I get it, that I will not die from it, that it's gonna be unto the glory of God. Wednesday, I started having symptoms and I was out of work. Like I lost the taste in my mouth. I had fevers, I had all the chills, body ache, everything that you could name it. But my test was negative and I came through it. Why am I sharing this? God went ahead of me and prepared that fight for me. So that is the hope we have in Christ during these times. That even if you have it, if you don't have it, yes, he covered you, he protected you. Because no matter the amount of PPE that you have, I believe fervently, it's God who protects me from it. It doesn't matter what I wear, the gloves, the masks, or whatever. If I have to have it, I will have it. But who protects me from it is God. If I don't have it, he prevented me from having it. He protected me. If I do have it, he's going to keep me. He's going to make me go through it and come out stronger. You know, as I'm speaking to you right now, my son has symptoms. But I know God will cover him too. You know, I know God is going to cover him too. So do I lean into fear or my faith? I lean in on my faith. Because he's the only one that I can trust right now. Trust him, believe in him. Don't give up, keep praying. He will see us through. He has a reason for this. So many of us will come out stronger at the end of it all. That's all I have to say. Thank you.
Thank you, Connie.
Wow. Thank you, Connie.
Awesome.
That was powerful. I think you got everybody here in tears. That was really powerful. And we thank God that he has done what he does best. You know, heal you and he will heal the baby. There's no doubt in that, because he definitely does not leave his children. He will always fight our battles. And he stands in front, on the sides, and behind us. So we just have to believe and exercise that. And, you know, your suggestion of nurses actually praying before they're shipped, it goes without the saying, when your mind is well and your soul is well and all your environment has the right mode, you definitely can function better and with great satisfaction. So I am so pleased. One of the things that you mentioned that's happening in our local communities, organizations that never believed in prayer or really saw the importance of it are now turning around and saying, hey, it's okay to pray. So who knows, maybe our school systems will go back to praying in the classrooms, because we definitely need that. So it is really a joy to know that we're moving in that direction. And you had some comments. Denise says he is able, and Angelia said the way maker, and Linda says prayers to you and your son, it is well. Yes. Amen.
Amen.
So
Amen.
thank you so much. We are moving right along.
So,
I'm doing great.
I have a little tribute to give out, to shout out. I didn't prepare any remarks for it, but it goes without saying, Dr. G has been an inspiration to me. I remember when I first moved to the US a long time ago. So, and I met her in the Cameroonian community. She was one of the person that drew me closer. Like she said, I'm her daughter, a friend, a colleague, and she has been my teacher. I remember calling my mom and saying that I met a lady that I want to be like. Do you know what she told me? That everywhere I go, everywhere you go, you always find somebody that inspires you. I'm like, Mom, listen, this woman moved from Cameroon. She started as a CNA, and now she teaches me in my school. How amazing is that? I just want to be like her. But I just want to be like her. She empowers me, encourages me. And when she was a teacher, she was tough too. She was really tough, but she encouraged us she saw in us what we couldn't see in ourselves at that time. And I really appreciate that for what you did in my life and the lives of all my friends. We had a whole community of African students in her class. So, and she took us as her sisters, as her children, and she had to push us to be better than who we are. I appreciate you. I know I've told you before, but I really, she's still pushing me to go for my doctorate. I don't know how she's gonna succeed with that, but but I really appreciate you. You've inspired me a lot. I've met a lot of mentors in my career along the path in informatics. My current boss is one of those who inspires me. She has a knack for data that I didn't love maths, but she pushes me to get into that statistics and data. You can't do informatics without it, without knowing it. What are you going to show? You know, so Kim Scott is one of those who inspires me too as a leader. So I give a shout out to all of them. Thank you very much.
Wow, wow. Thank you, Connie, for those kind words. I really appreciate it. And yes, you've done well. You've made us proud, and just continue to do what you do best. And we salute you as well during this Nurses Week. And like I said, it should be Nurses Day every day.
Yes.
Yeah.
Thank you.
Thank you. So now we have Denise. And Denise, you did not send me anything, but I'm going to share your picture and you can introduce yourself. Give me 1 second. All right, you can go ahead, Denise.
Okay, so first of all, it's awesome to be with you ladies. Some of you I haven't seen in a very long time. Some of you I've seen in yesterday. So I do want to thank you, Eunice, for putting this together and for including me. So I have been a nurse for over 35 years. You know, I was doing the math this morning and I said, actually, yeah, I started nursing when I was in high school. So it's been a really long time. So I've practiced mostly in critical care in the medical, surgical, ICUs, cardiovascular, the emergency department. I started as a CNA. I worked as an LPN, a staff nurse, a nurse manager, you know, multiple positions. But I do love being a clinical nurse specialist. I think personally that's the greatest job in the world because you get to affect the patients, the staff, and, you know, the organization as a whole, your community. So nursing, you know, Gifty talked about before about, you know, your passion. Nursing is definitely my passion and definitely my calling. I really can't think of any other career that I really would do. Even on my worst day, you know, I had a day this past week where we had a 2-hour resuscitation, and I literally dragged myself out of the hospital in my car, you know, to get home. And I'm really grateful for the opportunity that I get every day to impact lives, whether it's a patient, whether it's a nurse, a visitor, just someone in the hallway. So I truly nursing is my passion. My topic today is emotional intelligence. So funny enough, that's the topic that Eunice suggested for me, and it really is a topic that's near and dear to me. So basically, emotional intelligence is really understanding yourself and being able to manage your own emotions. And I have to say, it wasn't until I was close to being 40 years old that I really got to understand myself. It really took, and I have to say, it took me about a year on someone's couch to figure that out. I know that Nadine talked about before about going to counseling, and, you know, in our community, that's not really something that, you know, people are comfortable with and doing. But I must say, I spent a pretty penny and spent about a year on someone's couch to figure it all out. And it really has helped me to really become more emotionally intelligent than I was. So for most of my life, I just sort of was in survival mode. So now I'm learning how to, really live life. So it's really a topic for me that I really feel strongly about. And one of the things about emotional intelligence, besides learning how to manage your own emotions and learning about yourself, is developing empathy, which in this COVID crisis, you would think maybe wouldn't be a problem. So we, as professional nurses, we're used to having empathy for those that we care about, which is normally just our patients. But we also have to have empathy for each other. I've seen nurses function under some incredible conditions that I've never seen before. And like I said, I've been a nurse for over 35 years. And I've seen nurses really practice, we've made an ICU outside of an ICU, and having nurses really be able to practice outside of the environment that they're used to with the support system that they're used to. So they're out on a regular unit, creating an ICU out of ICU, which I think is just phenomenal. But really having emotional intelligence is such a key for being in a healthy work environment and for really taking care of ourselves. Nurses are famous for not taking care of ourselves. I'm like Eunice. I'm very guilty of that. I'm all about going into overdrive to, if there's a crisis, I'm there, to help somebody, to, do my fixer thing that I do. But I've really learned, and even in this crisis, that I really have to really take better care of myself. For, Angie, said before, we're really good friends. Connie is my buddy at work. And they know that a few months ago, it was actually, maybe a month or so before the COVID crisis, I started breaking out into hives. And Angie was one of the first people that knew about it, because I took a picture of my arm one night when I was on the phone talking to her and said, look at this arm, what's going on? And she said, you need to call your doctor about it and whatever. So, and I had been getting treated for it and what have you. And like Connie, I was home on quarantine for a couple of weeks, not because I had symptoms, but because I had a possible contact with someone who was positive. And in retrospect, I wasted 2 weeks because I sat at home and worried. And the child of God that I am, it's like, why was I sitting at home worrying? There's so much that I could have done in those 2 weeks. And the very first day that I was home, my hives came back in full effect. And, and they sort of been coming and going for the last, like 6 weeks or so. But I wasted a lot of time that I should have taken to take care of myself. It was like God gave me that opportunity to take care of myself, and I missed it. Because the very 2 days after I was sent home on quarantine was a day I was supposed to help with testing, and in retrospect, like Connie said, God protects us from things seen and unseen. I was all gung-ho. I want to be at work and I want to help and do whatever I want in this crisis. And I was supposed to do testing 2 days before I was in quarantine. So, in retrospect, probably after the first week of pouting, being home and not being in the thick of things like I like to be, I realized, I said, who knows if God didn't use that to protect me from COVID by not going out there and being involved with testing. Even like Connie said, even with all the PPE that we wear, at the end of the day, it's not the PPE that's protecting us. As children of God, it's God who's protecting us. So I did. I wasted 2 weeks home worrying about it. And then when my 3 coworkers who were on quarantine with me, when their test came back in 3 days and mine took an extra 6 days to come back. Then I'm like, well, why is it taking so long? Is it because it's positive? Knowing that with the history of asthma that I have, that if I had COVID, I would have known in the first couple of days, because I probably would have had to go to the hospital, but I let fear take over instead of me using that time to really take care of myself. So, part of being emotionally intelligent is having that self-awareness, having that self-regulation, having motivation. So for 2 weeks, I left my motivation outside the door. It's like that Wednesday evening when I came home, I checked out, So that's one of the things as nurses, I think we have to learn not to do. We have to understand our strengths, understanding our vulnerabilities. One of my strengths, when Eunice and I spoke yesterday, and she said Connie was going to do the spiritual piece of it. I said, oh, I could have well done that either. And she said, oh, you and Connie, you're like, she said, you're like preachers or whatever. But, I know a lot of the word of God. I'm very sold out for God and things like that. But for a moment, I let myself forget about that. So we have to know our strength, know our vulnerabilities, and to know what I should have done is I should have called Angie. Angie and I, a few months ago, Angie asked me to be her prayer partner. So for months, we had a routine at 6:45 in the morning, and I'm not a morning person, that I would set my alarm and wake up and we'd pray. And instead of me reaching out, which is one of the things that we have to do, when we feel ourselves in that crisis mode, we need to reach out to somebody, that person's going to help you to get through whatever that crisis that you're getting through. Or at the end of the day, if you had that really bad cold or that patient that you thought, was going to do better and they didn't, that you reach out to someone and kind of debrief and talk to that, talk about that. And it's really being in touch with your feelings enough to know, instead of me coming home and going into a shell and shutting myself off, now is the time for me to reach out. Reach out to someone who's going to really be able to walk you through it and listen, and just to be able to talk through it. Instead of always looking at things in the negative, look at things in the positive. One of the things we've seen in the media is all we see is they talk about the death toll, the number of positives and how many people have died. Well, can you show the numbers of how many people have survived? So one of the things that we started to do, I don't know if we're doing at both campuses, but at my home campus, is when patients are leaving that have survived COVID, we gather out in the main lobby and we just have a little cheer party when they're rolling outside. And, some of the nurses that have been involved in their care, other people from other departments that maybe had nothing to do with the care, we just gather and we celebrate the life of that person, and to be able to, show that person how happy we are, that they survived. So we have to learn how to turn those negatives into positives. Listen to your emotional gut. If you feel yourself, going into some kind of depression, or if you feel yourself, feeling weak or whatever, listen to your gut. If you want to cry, just cry. And I found that it took me about 2 weeks of going back to work and seeing it for myself up front, what it was like to really cry. It's sort of like my adrenaline kicked in, and I went in and I'm helping everybody, I'm checking on everybody else. And it took me about a good 2 weeks of that to really come home and really shed some tears. And it really, made me feel better. So be aware. Another thing we have to do is be aware of our responses, how we respond to things when we're under emotional stress, because we know ourselves better, than any earthly body anyway, that knows us. So we have to be in touch with ourselves and know, based on our response, how we're feeling, and really know that you're under stress, and know that, you need to take a step back, because one of the things that I do now is I round on all the units, and I face to face. One of the speakers before said that I face to face, I think Gifty talked about that, go and talk to staff, ask them how they're doing. I see a lot of the nurses that have been reassigned that Gifty talked about that haven't worked on the floors in a long time, that's been in the operating room or, another procedural area for a long time. And now they're on the units, they're in ICU, they're in the ED. So I go up to them and I ask them, how are you doing? Or the ICU nurses that are out of the typical ICU environment, they still know what they're doing, but they're out of their safe zone. So I take the time to go around and just, talk to them and tell them, just don't tell me I'm okay if you're not okay. It's okay to not be okay. And as nurses, we're not used to, what we consider falling apart. We're not used to showing, those emotions, if your patient's not doing well, or you're there holding your patient's hand at the last minute that they're going and they're transitioning, cry with them. It's okay. And I think, as we're FaceTiming family members during those times, I think it helps the families if they could see the nurses there with my loved one crying with them. It's okay. It's not a weakness. It's okay to do that, and it's going to make you yourself feel better, at the end of the day. We also have to learn how to respond rather than react. So we have to take a step back and take a moment. And in our human flesh, reacting is what we often do first. I mean, I did that for about 2 weeks at home. I was in my reaction stage. I didn't really take time. I didn't take that time to really respond. But, in any event, we really have to be able to, take care of ourselves. We're not going to be able to take care of each other. We really need to understand our emotional triggers. We have to understand the things that are really maybe going to touch us and really going to make us respond in a negative way. And if we see that trigger, if we can avoid it, avoid it. If we can't avoid it, then we have to figure out how to channel it and make it to be a more positive response. Understand the nonverbal messages you're sending. I mean, right now too, that's one of the things that's been difficult with nurses and other colleagues wearing all the PPE that they're wearing. We can't see their faces. We can't, we can barely see their eyes under, their glasses, their goggles, their face shield. So our body language, we have to really now be extra careful about the message that our body language is sending us. And to remember, we're not all created emotionally equal. The key is you have to know yourself and really know how you're coming across and really know the things that will upset you or not upset you. So, emotional intelligence just sounds like a fancy term, but it's really, at the end of the day, understanding yourself and being able to really just to manage your emotions. And part of that too is really being there for each other and learning how to, take a step back and be emotionally healthy and take care of yourself. I think Eunice might be having a problem with her computer again.
I am here.
Okay, yeah. So again, just really taking time to reflect, look on the inside of yourself, and taking better care of yourself. Because if you don't do that, you're gonna carry all that burden with you when you go into work, and trying to take care of other people. You can't take care of other people if you're not taking care of yourself. that's a hard life lesson that I've been learning for a few years now, and every day I learn something else. And really, you know, as the last speaker and following everyone today, I really, I'm sort of energized to do more to take care of myself. So I just want to thank all you ladies for that. I do have tributes to some nurses that have shaped my life and shaped my career that I'd like to do. I don't know if Eunice has those.
I do. Give me 1 second and
Okay,
I'll bring those up. Mhm.
Nice job, Denise.
Thank you.
Good job. Yeah.
So, I mean, I've had many, many nurses that have shaped my career, but these ladies that Eunice is going to bring up have really, for the earlier, actually the earlier parts of my career really shaped me.
Can you, are you able, can you see my screen?
Not yet.
Not yet. Okay. Maybe I went too far.
You
I need an award for this technology.
doing good. I'm good.
Hold on. Oh, I don't think I pressed the,
Your screen. Okay.
I'm coming. All right.
So the first person I would like to give tribute to is my my Aunt Celeste. So the picture on the left was me as a child. I spent a lot of summers with her. I spent a lot of time with her. The picture in the middle is her younger self when she was in nursing school. So she's the first nurse to have an impact in my life and my nursing career. She actually delivered me. She was a midwife as well. She studied in England, and she actually had to give me mouth to mouth at birth. I was born with my cord wrapped around my neck, and I wasn't breathing. So she literally breathed life into me in the beginning and breathed life into my career. She's always been a phenomenal nurse. She retired a few years ago, but she's taking care of, you know, the span of people, from the people in our village back in Jamaica to taking care of very famous people over the years. So I love her, and I thank her for starting my life literally and shaping my nurse life. The next one. This is oh, the name didn't come up. This is Yvette Mooney. She is my first chief nursing executive that I had in my career. She gave me my first leadership position at the age of 25. I still remember being in her office and she, you know, talking to me about that position. She was truly a visionary nurse. She's retired now, but she was one of those people that just had such a vision and always thought outside the box. And, you know, some of the things that we're doing now in nursing and medicine, when we talk about, you know, the mind, body, spirit, and all that kind of stuff, she was doing that 30, 40 years ago. I mean, she was way beyond, you know. I know sometimes in the lobby at one of our campuses, they have a harpist there to play. That stuff she did 20 years ago, when she would have someone come to the hospital and do those kinds of things. I mean, she really was a visionary. So really, really, two of my first leadership positions that I got in nursing, being a nurse manager at age 25. I look back at that now and I just shake my head. And then, you know, my clinical nurse specialist position that she granted me as well. So I thank her. And I think I had one more. Oh, two more. So this is Annette Aileen. She was my director in critical care when I was a nurse manager and when I was a clinical nurse specialist. She is a fabulous lady. She's talk about emotional intelligence. She has it, and I learned her at an early age in nursing about emotional intelligence, because she had to take me aside one day and teach it to me in a very, very nice way, because I was about to do something very emotionally unintelligent to a nursing superior. And she called me into my office and kind of set me straight and kind of, did the take a step back and take a breath. So I thank her. She's a fabulous, fabulous lady. Her spirit is just so awesome. She's an awesome woman of God, and she's really helped to shape me. So I thank her. And I have a last one. I don't have a picture of her, but Joanne Kaplicki, talk about a fabulous nurse. She was my clinical nurse specialist when I graduated with my bachelor's degree. And I actually took a job in critical care when I did, because she was going out on maternity leave and I wanted her to teach me all she knew. So I took that position, and she really gave me my foundation in critical care, and I wanted to be her. And I had the pleasure of working with her as a CNS after I graduated, and had been practicing being a CNS for a few years. So it was wonderful, to be able to work side by side with her. So I thank her. She is some kind of fabulous nurse. So I thank her.
Awesome. Awesome. Thank you so much, Denise.
You're welcome.
Let me go ahead and stop this for a second. Awesome. I believe what you just said, I'm sitting here feeling so guilty. Because honestly, that emotional intelligence piece, it's just, it's something that I have to work on, because as strong as I am, and trying sometimes to console yourself and sometimes put your emotions in check, there are times when I do let it get to me. And I really need to work really, really hard on that, because as you said, it drains you, you lose focus, and it's what I call allowing things that you cannot control take control of your brain, or people that should not be around your environment, be in your head. That is something that I need to work on. So thank you so much for sharing those tips for us to turn to positives instead of the negatives, and being more conscious of who we are and being present with us. And you could not have said it any better. Nurses are famous for not taking care of themselves, like we all have been saying all afternoon. So thank you so much for that. And let me see if you had any questions. No. All right, just pretty much everyone agreeing through that. Thank you, Denise, and yes, indeed. So thank you so much. I believe, is Mama Stella still on? I'm not sure if she did her tribute earlier.
Yes, I'm still on.
Okay. Were you able to do your tribute?
Yes,
It was
but I
you,
can
of
do it
course.
again.
She did.
It was you.
Oh,
I
you
did it when
know,
we were offline.
I lost power to my computer. Well, you guys have all been so wonderful. I appreciate each and every one of you. I am really blessed to have you in my life. So let me go ahead and pay my own tribute. I do not have pictures because I could not get them to send me pictures. So the first person that I would like to pay tribute to is Miss Angel Dewey. She's the Director of Education at Bay Health Hospital. And I tell you, this lady, back in 1998, she is the reason I am the nurse I am today. Leaving the classroom and going directly into the intensive care unit was not an easy task, nor an easy journey. But it took me another 6 months for somebody to teach me the real workplace life. and not what I knew in the classroom. Being a confident student, I thought I had it what it took to be there, and being the fact that I was already working as a CNA in ICU would be easy. No, it wasn't. However, it became easier because I had a mentor such as Angel Dewey. What I know in critical care today, she pounded it upon me. I felt like I was in another school, in a classroom, having to go home daily after working 12 hours to study because Angel will not leave me alone. And I am glad she did that. So I know she's probably not online, but if she were to hear this, I am so honored, Angel, that you took me under your wing and taught me what you had learned and what you knew. So I am grateful, and I salute you on this Nurses Week, and just continue blessing others like you have always done. It is no surprise that you're now leading the education of the nurses at Bay Health. Thank you. My next one is Miss Cindy French, another nurse in ICU, who had me to check my emotions at times. I remember vividly when we had an 11-year-old child who was shot with a BB gun come through our doors. And I can tell you, peace is not my thing, and it never has been. So in my mind, I see this child being rushed in, it's a code, and I'm in charge. A new nurse, a couple months later, and I'm like, okay, what am I supposed to do? This is overwhelming. I'm feeling really drained right now. And Cindy pulled me aside and said, you got this. You just need to breathe. We can do this. If nothing else, I am PAL certified. I will be with you. And we can look into books. I tell you, that reassurance, just letting me voice how I felt, was powerful. It changed my perspective. When we have codes and somebody is panicking, it taught me empathizing to others in situations like that. It also taught me to take a step back and think of what is going on and if I'm really bringing value to that situation at the time. And I have learned to do that in the classroom with my students, out in my personal life, and with people that I interact with. And that is one of the reasons why I always encourage students and new nurses to really hold on to someone, have a mentor, because there's nothing like being confident. Yes, some people will see that as being arrogant, but you're just being assertive because you have confidence in what you're doing. So if you don't have somebody, if there are any nursing students listening to this, find yourself a mentor. Find your support system in that place that you work, so that in times of difficulties and crisis, you can always lean on somebody. So I thank you, Cindy, and I wish you good continued health as you recuperate from your illness. Then Dr. Lacey. Dr. Lacey became my mentor back in 2014 at Delaware State University, an elderly nurse that has been a nurse for over 52 years, and of a sudden comes in and sees this African-American or Black girl and pulls her to the side and said, you have got so much value. Nobody has ever told me that before. And it created a shift in me. It made me become more aware of my surroundings and who I was with and who I am. And it reaffirmed for me that I do have value and I have a big foundation and one that I can be of help to my community, my society, and if not the world. So I just like to thank Dr. Lacey for her vision, for even taking homeless people off the streets and turn them into nurses, and for her work in underprivileged communities. I could not be more proud to be in her circles. And for that, Dr. Lacey, I salute you. I may not call you every day, but know you're always in my thoughts and prayers. Then Dr. Finley Christian.
Yes.
For all of those of you in Bayhard know Dr. Finley Christian. She happens to be my sister and a family friend. And back in the days of nursing school, care plans again, I would carry my care plans after I've bathed my 10, 14 patients, and I'm sitting there as a CNA on IMC doing my care plan. And one afternoon, I was actually doing the care plan, but reading a newspaper. And she walks up to me with her feisty little self and said, "Come here for a second." I said, "Uh-oh, what did I do now, Auntie Gertrude?" So she pulls me back into the break room and she said, "If you are going to study, my dear, make sure you're not studying at the nurse's station. It doesn't bring good representation nor professionalism." I said, "Oh, okay." All I was worried about is doing my work because my care plan is due the next day. And she said, "Yes, I understand, but if you want to stay here longer, you don't want to lose your job, you need to do that in the back. We all know you're in school and we all want you to do well. So please do those things in your nurses' lounge and not up at the nurses' station." And that has reminded me so much in my entire career, like even with the cell phone things right now, I have to think twice when I'm at work to even carry a cell phone with me, just because you have emergency, so you should carry it on. But it's very difficult because that has always stayed in my mind. What am I doing? Is it professional? Am I being a good representation of my profession? So Dr. Finley Christian, I thank you for setting me on a good path and for those guiding principles. And another, last but not the least, is Prince. She was an LPN in ICU.
Wow.
When I stepped foot in ICU at Bay Health, this African American beautiful lady set me straight. She would talk to me and roll her eyes.
Yes.
"Where are you from again? From across the waters? How did you get here?" But then she would turn around and remind me I was the only one who could teach her something and she would understand. But being human, I was confused. I'm like, okay, I'm the only one who could teach you something, but you cannot understand my accent. So which is which? We're getting confused here. And one day she actually said something and I got so offended. And I pulled her to the back. I said, "We got to have this conversation." We had the conversation. I told her statements were very condescending and I took offense to them. But in the midst of this conversation, we both realized that she did not even understand nor realize she was even doing that. And she expressed her love for me and how much she appreciated my help. But that is when you really learn about taking advantage of teaching opportunities. Had I not pulled her to the back, I would not have had a friend today. She's one of my best friends today. She's the one who stayed with me 24/7 when I lost my son. But that is a lasting relationship. And that is why I always, always give back. Because I haven't gotten this far by myself. I have a village that has supported me and continue to support me. And I may not say it every day, but I respect and honor and appreciate each and every one of you here today, because I give a shout out to each and every one of you that have spoken today, because you mean the world to me. And that is why I called upon you to have this conversation. I've seen what you're doing in the community. I may not reach out on a daily basis, but I keep tabs on you. So I thank you, each and every one of you, for being who you are, for being the leader you are, for being the nurse you are, and for what you're going to do. And for those of you who are going for your doctorate, good luck. And yes, Connie, I'm referring it to you, to Angie, to Denise, everybody. Because if we can do it, you can do it. Statistics show African American educators are lacking. We just talked about the need to have people that look like you when you're trying to accomplish certain things. Our classrooms are going to be filled with people of color, we also need teachers of color. Statistics show that 45% of students in the public school system are from disadvantaged backgrounds, who are taught less of, who the 80% of Caucasian classroom teachers think less of them, have already given up on them. The question I ask you ladies is this: how are we going to stop dropout rates? How are we going to prevent our communities from being a statistic? How are we going to make the African American and people of color nurses or colored nurses realize that they're bringing just as much value to the table? What is it going to take for an immigrant nurse to walk in confidently and apply for a job without having to second guess themselves? What is it going to take for an immigrant, a Spanish nurse, a Filipino nurse, or a Filipino male nurse to not be prejudged, either in the classroom or at the job place? Because when you have an accent, of a sudden, you're not intelligent enough. How do we stop that? It's going to take each and every one of us to do this. No one person can do it alone. I believe it was Nadine who said, together we're stronger. It is a journey. It is a journey we're on. During this time of COVID-19, with most of us dying, nobody knows what these people said. My dad personally lost a friend to COVID-19 in Washington, D.C. 2 days ago. The question is, did he even say anything before dying? Did someone hold their hand? So we must, nurses, we must, my sisters, let us take care of us first so that we can have the health. We can have that wealth of love and peace and joy and happiness to touch someone's hand that is at the end of life, to touch someone's hand that is ready to transition to the next world. Because if you're not whole, mind, body, and soul, you cannot give what it takes. If you're not whole, you cannot give them good, culturally sensitive, safe, and quality care. You're just doing it to pass that 12 hours. You're just doing it to collect the check. But let us remember why we went into this. What was the purpose of you becoming a nurse? Yes, it's a calling. I said earlier, you're wearing more hats now than you've ever worn before. You're a power of attorney to somebody's father, to somebody's mother. That means you have to make certain decisions because the family is not right there. The only difference is your name is not on it. But by your calling and Good Samaritan law, you're making those decisions. So we're not just having this conversation today for the sake of having it. We're having this conversation because we need to take it a step further. Yes, COVID-19 is here. We're not going to change that. You can agree with me that it's already in history. And once something is written in history, it's going to be there. But what we need to take out of the history books is the lessons that we can use to impact lives. Is the lessons that we can use to continue impacting and bringing change. Yes, change sometimes comes when things are uncomfortable. As healthcare workers, you all can agree that the adrenaline sets in. That flight or that fear when we feel that our safety is threatened, which is what we're going through right now. So we must, and we should, and we will change the conversation and the status quo. Somebody said earlier, we need to become politically savvy. Be active in your community. Be part of the decision making. You have value. You're unique. You have this hidden treasure that is sitting inside of you, and you're not bringing it out. So you must tap into your greatness. As Mama Stella says, you were born with greatness, and you're sitting on it. Crack it open, because someone is waiting for you to inspire them. Someone is waiting for you to embrace them. The fact that they're different doesn't mean anything. What it means is they have something you don't have. Putting both on the table empowers and encourages both of you and your entire team to do better. It helps your organizations be more productive, have better outcomes. Yes, you're going to be paid based on how well your patients are doing and not coming back to the hospital. Let us not focus on that paycheck from Medicare and Medicaid. Let us focus on the feeling that we're impacting and putting on our patients at individual levels, as individual nurses, and as organizations. And yes, we must, as nurses, be in unison. We do not work together. Because you're different, I think you're less. Because you sound different, my clique is better. Leaders, do not pick and choose who you're gonna ask, are you okay? Be intentional what you're gonna do when they're not okay. Do not hand select who you check on or who you give a better schedule, especially now. And do not wait until we have crisis to worry about your staff or the well-being of your staff. You must do it on a daily basis. Just like you nurses or us nurses have to have our maintenance self-care plan and our emergency self-care plan, we must have a plan for crisis and maintenance at our job places. Because again, my colleague always says, peace-poor planning brings peace-poor results. So as from today, we must plan if we haven't been planning. We must put in place an infrastructure and leaders who will agree with their communities and those who have the expertise to say, we need PPEs. We need to quarantine for 14 days. We need WHO. We need CDC. We need the resources and the recommendations. And as a leader, you must do your research before you make recommendations or rely on your staff. So nurses, you're the ones at the bedside. You've always been heroes. It is not today that you became heroes. So from this point going forward, nurses should take their seat on the table, and I mean the political table and the decision-making tables at your places of work, because you're the one who knows where that sink should be positioned so you can wash your hands in a timely manner and prevent infections from crisscrossing to other patients. You're the one who knows which Pyxis system will work better for you and its location, and what equipment you need to do your job. America should not be running out of ventilators. We should already have that infrastructure in place. So be that leader, become those leaders who will put in the minds of the leaders of the United States of America that we got this, that we are trained and we know what our communities need. Let us reach out and touch one another. At my company, our initiative right now, be the voice for the voiceless. So I call on you guys to be that voice for the voiceless. Reach one, touch one caregiver safety initiative. Be part of our team. Help us help our communities. Our elders in the community, our family caregivers, they're not trained to be nurses, but they're doing nursing responsibilities at home, and we often forget them. I am honored to be a family caregiver and a professional caregiver. So let us all, in our own individual ways, reach out to who we can. Even if it means donating food to the elderly population, finding a mother in the community who has kids and doesn't have food, or people who only get food when school is in session, you are blessed. We are blessed, and we can bless others so that we are all happy and a healthy nation. With that, I'm going to stop because we can answer some questions. I will give everyone a chance to say their last words or comments, and we can start with Mama Stella. Is she still on?
I'm still on.
Okay.
Oh, wow. Wow. That is what I can say, Doc. Like I'm moved, touched, and inspired by all the trainers, the knowledge, the information. And I just want to give it back to you and say thank you for being a stand for nurses. That together, Courtney, Angela, Denise, Linda, Dr. Lewis, Dr. Winifred, Dr. Kimmy, Linda, Array, and one person is iPad, that we can be the voices to the nurses, the voices to the people who cannot voice themselves, and be the leaders in our workplaces, like in your hospital. Be the one to speak up. And we are in this together. And for sure, we are gonna get over this together. COVID is one of the pandemics that shall also come to pass, like other pandemics. So thank you all, ladies. It was amazing spending my afternoon with you all. And Doc, I give you hands up.
Thank you, sis. Thank you.
Yeah.
All right. Sis Gifty, you're next to bring your closing remarks.
Sorry, I had to jump off and went to another meeting. But what I wanted to close with is the resilience. Being a resilient nurse, able to bounce back and do what you are called to do. Let's help our coworkers. Let's help our staff members. Let's help each other in our nursing profession to push up and never give up. Whatever we want to do, we can do it. We just need to set our minds on it. Offer the resources that are available to our coworkers. Take time to pull yourself together. Do debriefing. Sometimes you need to recall what happened, what we could do better, and then next time, you move on. Resilience is very important. It's very, very important. And let's empower each other. Let's empower each other and be there for each other. And remember the 6 E's. The 6 E's.
Awesome.
To empower, to encourage, to educate, enhance, embrace, and engage. Thank you.
Awesome. Awesome. Thank you so much. We actually had a comment from Dr. Winnie, who is also a nurse and my dear sister, said, Dr. Eunice, I understand this language differences so well. In nursing school, I suffered it a lot. I could pass a test with an A+, but no one understood a class presentation. Guess what, Dr. Winnie? Look at where you are. You did not let that stop you. You used that to gain more momentum. And here you are today, changing lives in the community, giving birth to babies. Who would have imagined a little girl from the cornfields of Cameroon would be doing what you do, impacting lives? I salute you and I pull my hat up to you. And Dr. Winnie, if you want to say a few words, you're more than welcome. Is she? Okay. Can you guys hear me?
Yes.
All
Yes.
right, so maybe she's not on right now. She's muted, I can see. But I will, once she comes on. So Nadine, go ahead and make your remarks.
Okay, I just want to say thanks, thank you, ladies, so much for an awesome afternoon. Thanks for, helping me to grow and continue to develop on my path as a leader in healthcare and a human being. I just want to reiterate the importance of togetherness, the fact that we need to be helping each other. Please let us not just go back to our normal positions after today and our respective lives. We have work in our community to do. Black and brown people are suffering. We really need to begin to create awareness, find ways to help, and be it through a church, any kind of community organizations. We just need to begin to formulate plans on how we can believe to mobilize our people, emancipate them mentally, on how to care for themselves, how we are going to move our people forward in terms of, leaving the bonds of the 400 years and then try to, make progress in terms of, social determinants of health. How are we going to, create change? Now, I just wanted to leave one word with everyone. Mary Seacold, our own Jamaican nurse, she is another nurse founder. She lived 1805 to 1881. She could not, they would not allow her, she had no rights to, no right, literally. She was minority. She had no rights to vote. She couldn't hold public office. And when she asked to take part in the Crimean War, along with the Florence Nightingale, they said no. But it did not stop her from renting space in a hotel and administer care to the soldiers of the Crimean War. What am I saying? We can do something, anything at some point. We need to begin to mobilize our community, our people. That's the only way we're going to get moved from the stagnated status that we have been in for 400 years. I thank you.
Wow, wow. Thank you so much for those comments, Nadine. Yes, Mary Sickle was quite an impactful and influential figure in nursing. And if we all just sometimes stop and think of where we come from, we can celebrate ours more often than we do. And united, when we work in unison is when we can begin to do that. So I thank you for recognizing her. All right, Connie, your last words. Is she on?
Yes, I'm on. I was
Okay.
trying to unmute myself. Thank you once more for the opportunity. Thank you for all the amazing speakers. It has been a rewarding afternoon. We've learned a lot. I hope those who have been listening have also learned a lot. I just want to emphasize on how we respond to the crisis. We either choose to walk in faith or walk in fear. But I want to encourage everybody that is listening to us right now to walk in faith instead of fear. Because when we are afraid, when we are in fear, we tend not to act right, to think right. But we just have to take a minute to respond in faith to all the unanswered questions that are going on right now, to everything that we're hearing or seeing. And remember, the Bible says that we should not pay any mind to what we see, but we should pay our mind to what is unseen, which is a greater good. As nurses, as caregivers, we have unique opportunities to be present with others in their times of mourning, in their times of rejoicing. Take that opportunity to speak to someone, when you are in that place, when they're mourning, to comfort them, to encourage them. It may be hard, but when you find out when you do that, there's an inner peace in you that you're able to comfort somebody in their last moments. That's all I had to say. Thank you.
Thank you so much. Thank you. Let me also recognize, I see my dear sister from another mother, Linda Array, the queen of self-care. She actually could say a few words just to encourage us nurses. This is my powerful sister who is doing some amazing things in the community as well, and always bringing people together to share resources, network, and for her to be here this afternoon, then that means she took time to be with us, which is very encouraging, and it means a lot to me. So sis, if you're on, can you say a few words?
All right, all right, I'm in my chill mode, so. All right, ladies, just so I'm not a nurse, but I am so honored to be able to share a little bit of this afternoon with you all. And Dr. G, just, you did this. You should really pat yourself in the back because this was well put together. And I really would like to twist things. I know you said share something, but I would like you, Dr. G, to actually share more when we get out of this COVID-19, I know a lot of nurses, I'm a medical service corps officer in the Air Force. So we need our nurses and our nurses need us, right? But I also know the amount of nurses that have gotten laid off during this coronavirus crisis. So it's really time for us to reinvent ourselves. It's time for us to pivot as women. We are beyond our degrees. We're beyond the professions that we are in. And I'm talking about creating flexibility for our families, for our careers, and for ourselves. Dr. G, you are a woman that you owned a CNA school. You now own Unity Solutions. Like, you have been a professor, you have done it all. So there is no woman better to have this conversation with other women that are in the nursing field on how to pivot. What services does Unity Solutions offer that the fellow nurses on the call today can tap into for both professional development, personal development, and also those that are interested in branching out into entrepreneurial skills? I know a lot of you all probably don't speak professionally. Dr. G does. So what are some things you actually offer under your platform to teach these women to utilize their skill set, this knowledge, and monetize on that outside of the nursing field? Because we don't want another pandemic to happen and we are worrying about our bills, and not saying any woman in this call is, but it's really time for us to branch out and reinvent ourselves, and we need to be modern in our professions. So I really don't want to talk today, but I would say if that's something you can share with the rest of the ladies so we can all continue to grow and be better together. And thank you all.
Wow. Thank you so much, sis. That's the woman she is. You guys, I wasn't lying. That's just who she is. And, thank you so much for that recommendation. I wholeheartedly welcome it. And for those of, as you all know, I am not currently practicing at the bedside. I have been an entrepreneur, a philanthropist, a life coach and professional coach, speaker and author now since 2017. And it's not an easy transition. A lot of us as nurses, we have that in us to be afraid of that unknown, to think that you have to have money to leave that 9-to-5 job. So I took a leap of faith, plus other reasons. I needed a backup plan because in 2016, I had to leave my 13-year-old career at Delaware State University because I had a family need. So while being at home taking care of my father, what was I going to do to be able to still put food on the table? So I fell back to business. Even though I had a business from 2004 to 2009, the CNA program that trained over 230 students, some of whom are nurses today, 75% of them, as a matter of fact, are nurses today working side by side with me. So I did that. Not to say I had the experience. Sometimes, as Connie said, you have to have faith. So I did that, and now I do the speaking. I wrote my book in 2017, published it. As a matter of fact, I published it at the same time I was graduating with my PhD. So I've taken some of those skills, and I now am also doing, diversity, equity, and inclusion conferences, where we create that platform to bring our communities together to really begin to talk about embracing differences and the power of diversity and inclusion, where we celebrate our differences instead of putting people apart. We also were supposed to, next weekend, be starting a diversity ball. But unfortunately, because of the lockdown, we are not gonna physically have that, but we have something in the works for next weekend. Also, creating online courses. I am excited, and you all are the first ones to hear this. Nobody knows about it yet. But I will be launching my online course on June the 16th. Burnout or Blossom, a 6-week guide for nurses and family caregivers, teaching you strategies that you can implement to avoid that burnout so that you're happy, you have love, peace, and joy, taking care of those individuals that you take care of, going to work and being happy because you have taken care of your mind, body, and soul. So that's a lot of what I do, and you can visit my website. Linda actually also helps for those of you thinking about nonprofit organizations. She will help you put together your plan in no time. So if you had ever been thinking of doing a nonprofit or just starting a business, she's your startup queen. She will help you. So we're not doing this just to do it, we're starting a new circle. So let us help each other, let us uplift each other, let us lean on each other. I can tell you, I can pick up my phone and call Linda at any time, even when she's doing what she's not supposed to be doing. I can call her and she will stop and take care of me. So I am proud to say that I have a sister who can do that for me. So, and each and every one of us can do that for each other. And there's resources, there is help. You know, whether it's starting the business or it's starting a CNA school, I can definitely have experience in that, help you with that. So the online coaching, I hope that you guys get to register once I officially announce my course and be a part of it, because definitely you will benefit so much from it. It is going to be impactful and transition and transformational. So thank you so much. And I really am grateful for all of you coming today to share your time and experiences. So Dr. Lois, you can make your closing remarks because I can go on and on and on.
Thank you guys very much for this time. And I'm really so happy to meet some of you for my first time. And I pray that we work together as one, you know, to do great exploit. I just want us to have this that is going to help us. Some strategies, like when you feel stressed up, it's just something that just came up. Like we should take a time out, eat well, limit alcohol, get enough rest, take a deep breath, count to 10 slowly, do your best, and accept that you cannot control. So it's just something that I said, let me share it, because some of us, like you guys nurses, we're going through a lot, and this one is going to help us. And get involved, you know, talk to someone. It's going to help us to come out from depression and out from trauma. And I really thank you so much, Dr. Eunice, even for what you just said. And we have to work together. We have to be together. I know that us African, the truth is bitter. It's difficult for us to work together because we feel like we are more than one another. But for me, I like teamwork. You know, if you don't know something, try to get to one. Try to, you know, call somebody who can help you. And I believe that we're going to make a better team, or to help each and every one of us in any domain that we are. None of us know. I don't know more better than somebody, but for me, I love learning every day. And that is what is making me to be who I am today. And we should try to also put ourselves in prayers in this difficult moment. And don't forget to put our families, even those in Africa, those in Jamaica, those in America, that God should really fight this disease. I don't really like to call the name because it's really so horrible. The way I hear people dying, a lot of stuff is really happening. So I just pray that we should be like one. We keep praying, and we should keep on obeying the rules by putting on our masks. If you don't have it, you can contact me. I'm gonna send it to you. And we should also do the hand washing and stay away from depression and stress. Thank you very much.
Oh, you're so welcome, and thank you so much for your time and willingness to share your expertise. So Denise, you're the next one.
Yes, ma'am. So I just want to thank you. The time went by fast. At first, I'm like, oh my gosh, I'm going to sit in that chair for 4 hours. But the time went fast. All you ladies, it's been a pleasure spending the afternoon with you. And I really needed this because, you know, I could feel myself falling into, you know, a crazy routine. You know, I get up in the morning, go in and, you know, mask up and gear up, and then, you know, take the shoes off in the garage and run in the shop, you know, and next thing you know, I'm sleeping, didn't have dinner. So I'm really glad, Eunice, that you had the vision to do this program today to talk about self-care. I think, you know, the intention was for me to say something to help somebody else, but you ladies really helped me this afternoon to really get back on my game and, you know, get myself together. So I thank you all for that, and I thank you for the opportunity. But, you know, just the last words to say, you know, as caregivers, we need to really take care of ourselves. We really need to be more introspective, really take a look at ourselves. You know, I think, you know, God has given us all the opportunity to take a time to take a step back and think. He stopped all the busyness and all the things that, you know, we had to keep us busy, and not to take care of ourselves, and not really to stop and be grateful for some of the things that we have, you know. So I'm really I really want whoever is listening, and to you ladies as well, to really stop and really take a look inward and see the things that drive you, and to see, is it worth my mental health, my physical health, you know, all the things that we run around every day to do prior to this virus, that we really should, you know, now's the time to stop while we're not running around the streets all the time, and really take a look at the things that are driving us. Are those the things that should be driving us? To really stop and say, I'm gonna, you know, take care of my mental health as well as my physical health, because a lot of us don't do that. So, you know, just take better care of ourselves. We can't really take care of other people if we're not healthy ourselves.
Wow, awesome, awesome. Yep, it has been impactful for me as well, because I'm just sitting here. A lot of the strategies and things that everyone has talked about just reminds me that I need to keep some areas in check as well. So I have really been blessed, and I thank you all for that. All right, Angie.
Give myself a little sound. So thank you so much for the invitation. I'm sorry, I know I'm always on overdrive, but I have to tell you the truth. Last week when we talked about getting together and just chatting and some of the concerns that I had, the things that I was feeling in my heart, I could have never imagined that, you know, the God really just confirmed the whole thing with all these other women coming here together today to share different topics, but all of them just kind of came back full circle. Like one thing led to the next thing, which, you know, grew on to the next thing. So I'm always excited whenever I can be in a group of women who got it going on, not like, you know, the whole gossipy thing. Like, I mean, like really have something valuable to share. And quite honestly, I don't get to do that often enough. Or either, you know, it's like, okay, you pay and then you go to something, and it's really not anything near what maybe my heart had hoped it would be. But today, it was more than I thought it would be. And I was very nervous to come on with you ladies today. I will tell you that. I'm not really one for being afraid to talk in front of folks. You know, I just say what I have to say. But today, you know, the closer it got, the sicker I got to my stomach. I got to tell you the truth. I was so incredibly nervous. And before coming, I had another commitment. And I just told the folks, look, I have somewhere to be. I gave my word. And the reason why that's so important to me is that anytime you all call her Dr. G, and I just call her Dr. Eunice Guan-Misia, because it took me a minute to master that last name, so I just use it. Anytime I've ever asked anything of her, she said yes, it was yes, and she stuck to it. She did whatever it was I asked her to do. And when I listen to all of you give her accolades about who she is, it's everything that I know about who she is personally. So I'm just so excited to be in the company of so many awesome women in your own right. And a final word is just that, as again, stuff that's already been said, is that, you know, with mindfulness and being intentional about being grateful, it's important that we take care of our temples, that we nurture ourselves with what we eat, that we make sure that we get good sleep, that we are careful about what we allow to come in through our eyes, our ears, and all that stuff like that, the things we watch, all of those things, that they're things that feed us in a way that's helpful and that inspire us to move forward and be the best us that we can be, so we can take care of us and others. Thank you again for the invitation.
That's awesome. Awesome. And thank you so much for accepting to come and spend time with us and to really share your expertise on what you do and do best, and helping others, you know, do as well. So I really appreciate and celebrate you as well. Did I miss anybody? Did everybody give their last remarks?
Yes.
Okay. And I don't know if Dr. Winnie came back on or not. Dr. Winnie, are you there? I think she's probably not able to talk. Dr. Winnie does home visits. She may be delivering a baby somewhere right now. She might have her phone on, so.
God bless her.
Ladies, I really truly don't have words at this time, but I just want you to know that I am grateful. I am humbled by your acceptance to do this, and I really sincerely pray and hope that we can do more of things like this and we can work together. So I'm going to ask of everyone if it's okay to share everyone's contact with the group so that we can stay in touch with one another and be supportive to one another. If that's okay with you ladies, I will definitely be able to do that.
Yes.
Yes.
Awesome, awesome. All right, and Angie says her iPad is dying, but that's pretty much it. We just went, I know, 15 minutes past the time, and I hope you guys, wish you all a happy, happy Mother's Day. When we can go out again, we will go out and celebrate Mother's Day.
Absolutely. Oh, yes.
And celebrate Mother's Day. Just remain blessed, be prayerful, and be safe going out there. Maintain that social distance. And soon this shall come to pass.
Of course, yes.
Thank you all so much. Thank you all. I appreciate you all.
Thank you. Thank you.
You're welcome.
Thank you.
You're welcome.